Today, we are also going to share great insight. My name is Eunice Beko Nate. I'm a registered dietitian. And with me here is...
Nana Kofi Owusu. I'm also a registered dietitian. And yours truly.
Dietitian 1.
Thank you very much.
Okay, so today promises to be very interesting. So at this juncture, I would want my honorable dietitian 1 to introduce some very important dignitaries. Then we'll just move on. Thank you.
Okay, thank you very much, RD Eunice. We are welcome to UHAS. For those who've come from far, I would like to welcome you fondly to this place. I see we have our student body in the house. Can you give me a wave? Student body. Those from Ho. Can you give me a wave again? Can I see the Hohoi? Do we have Hohoi people here? Very good, very good. You're welcome. Can I have the faculty from Hohoi also give me a wave? Faculty from Hohoi. Nice. Thank you very much for traveling all the way. We're standing the road and coming to this place. It's going to be an amazing time. Right here, and I'm sure we'll take a lot of learnings out of here. We have very, very distinguished personalities here in Guarded. The number 1 of the university is around, and I'm sure that we welcome her very fondly. Can we please, with a round of applause, acknowledge the Vice Chancellor of the University of Health and Allied Sciences, Professor Lydia Aziato. Let the clap be resounding. Oh, a louder one. Thank you very much. Thank you very much. Okay, so having acknowledged our VC, we want to also make known to you that the Dean of the School of Allied Health Sciences is also in the house. SAS fellows, SAS mates, can we appreciate our own Professor Samuel Esienbedu? Please give us a wave, Daddy. Let them see you. Thank you very much for coming to back us with your glory in this occasion. We also have the registrar of the university, my very, very, very dear friend. She's in the house, Madam Ya Mante. Can we please appreciate her? Okay. Okay. All right. So I will come back on that. Apologies, sincere apologies for that. I'll come back on that. We have GAND people in the house, representatives from GAND, Ghana Academy of Nutrition and Dietetics. The secretary of GAND is in the house, Joseph B. Dankwa. Can you give me a wave? All right.
Joseph,
all right.
Can we see your hand? Okay, great.
Yes, can you come forward and let's see you. Please sit for us so that we can see you. We have Dr. G.S. Jati, I think it's Jati. The spelling is D-Z-A-T-I, if I'm saying right. Senior lecturer, HTU. Are you in the house? Okay.
Yeah.
You're welcome.
Welcome.
We have Jifa Adonu, Public Health Nutritionist, Volta Regional
Health Directorate.
You're welcome. You're
Jifa.
welcome. Dr. Innocent Apeke, HOD Medlar. I'm sure I pronounced this one well. Apeke.
Please make Apeke.
Apeke.
Yes.
Hey.
Apeke.
The tutorials must come.
Yes, it has to.
Being an Eweland
Yes,
and not be able to, you have to
give
learn
you
it. Yes. We have the venerable Professor Paul Amuma in the house.
Internationally recognized Prof.
Thank you. We have Togbi Ajima the Fourth. Togbi Ajima the Fourth, Guta Chairman. You're welcome. As and when the dignitaries come in, we'll add the introductions to it.
Okay, so we also have representatives of GAND and also Send Ghana. We also have our own very HOD, Nutrition and Dietetics here. We also have reps from our Nutrition Department here as well. We have Dr. Agbozo. Dr. Agbozo, we want to see your face. The beautiful Dr. Agbozo. So thank you all for coming, and please enjoy the discussions that will happen here today.
All right, so we want to take a welcome address, an official welcome address from the father of SARS. It's at his behest and on his laps that we ride with this program. Please put your hands together. Let's receive Professor Samuel Essien Beidu.
You're welcome.
Distinguished guests, the Vice Chancellor, Professor Lydia Aziato, the Registrar, Ms. Ya Amankwa Opuni. I hope I got that right. Esteemed colleagues, invited guests, the head of department, representatives of GAND and Sen Ghana, faculties, students, friends of the media, ladies and gentlemen, good morning. I have the singular honor to welcome all of you to the University of Health and Allied Sciences and to the School of Allied Health Sciences, where the giants are rising. It is with great joy and pleasure that I welcome all of you to this significant occasion, where I believe that we would all share in the excitement of this gathering to exchange knowledge and collaboration in the area of nutrition and dietetics. On behalf of the School of Allied Health Sciences, I extend my heartfelt appreciation to all of you for making time out of your busy schedules to join in this discussion on front of package warning labeling and nutrition profiling models. Madam Vice Chancellor, ladies and gentlemen, it is obvious that in this era where health conditions are escalating, more importantly, where we're seeing rise of cardiovascular diseases, obesity, diabetes, amongst many others that are related to nutrition, it has become very important for us as consumers and stakeholders to have an earnest discussion on this matter. It is very insightful to know that if we have clear and accessible information about nutrition, about content of packaged foods, and how essential it would be in guiding our daily choices, it would help improve our life outcomes. Today we come together to explore these complexities of consumer awareness and nutrition policies to gain deeper insights that would drive informed decisions and public health interventions. As a school, we are committed to advancing health education and research, and this symposium aligns perfectly with our mission to bridge that gap. I'm very confident that our discussion today, the knowledge we'll share today, would inspire innovative strategies and promote healthier lifestyles and improve our overall well-being. I want to encourage all of us here and those of us online to actively participate in all the sessions, share your perspectives, and contribute to the discussions that will shape the future of nutrition and consumer health policies. Once again, I extend my warm welcome to all of you and wish you a fruitful and engaging symposium. Thank you.
Thank you very much, Prof. Please keep clapping. Thank you very much. So, as we have from history, we have John the Baptist who introduced Jesus of our time. In the same way, we have Prof introducing or coming before a very honorable, we would say, Jesus of Uhas. At this point, I have the singular honor and privilege to introduce a very distinguished woman, a very accomplished woman, my mentor, someone I look greatly up to, and she has a word for us. Well, she's not just the Vice Chancellor of the University of Health and Allied Sciences, I mean the best university in the whole of Ghana, and then, oh, Prof, please, are you coming already? Let me still sing your accolades, Prof. Please, ladies and gentlemen, we have here the Vice Chancellor of the great university. Thank you.
Thank you very much, Eunice. If I allow her, she will talk plenty. So, good morning to all of us. Oh, good morning. Thank you very much. It is a pleasure to be here this morning and to welcome you to the University of Health and Life Sciences this August morning. I was hoping that when I entered, I'll see some posters of research relevant to today's symposium from both SARS and Baker School of Public Health. The topic is on food, it's on nutrition, it's on labeling, it's on nutrition profiling. So I'm hopeful to see some work, no matter how few. So moving forward, I want to see that. I'm also happy about the collaboration between the two schools doing this together. It is very, very, very heartwarming. And I also was hoping that I'll see some people from the Ghana Health Service, because if we are sick, they are the main people. They are private one, CHAG and others, but the Ghana Health Service is a heavy load service provider in terms of our health. I was hoping to see them. I was also hoping to see FDA. Are they here? Anybody from FDA? You are here. Excellent. So it is good that you are here, and I'm very, very happy that you are here. The welcome message that I have drafted, if you know me very well, I'm not a fan of reading speeches, so I'll do my own thing. The fact that you are what we eat cannot be overemphasized. And some of us, we go to the market and buy things, and we come and cook it, and we eat it. Over the years, there has been a lot of concerns about what we buy on the market. How was it produced? How was it transported even? What was used to even, shall I say, water the vegetables? Some years back, we got a lot of concerns, stories, which I don't want to belabor. Now, when I look at the topic, I don't see the traditional unpackaged food. I see labeling. So the labeling means that the one that is factory-oriented, business-oriented, fine. Now, I don't remember the last time any of us, before you bought any item, took time to even look at the label. We trusted Coke from the very beginning. So if I'm buying Coke or I'm buying Fanta today, I don't know what is on the paper. I only see Coke and I buy. As to whether it is expiring or not, I don't know. I believe that the company will not bring anything unhealthy onto the market. So how do we make Ghanaians? So I'm talking about Ghanaians. When you travel and you are buying things with other race or other people, they'll pick it first and look at it. A typical Ghanaian African will just pick it and put it in the, I do the same, okay? So how do we make our people conscious of the fact that before I use my money to buy anything, I have to look at what is written on it? Now, if I look at it, for some of the things, the writing is small, small, small. I can't even read without my glasses. Maybe I didn't go to the market with my glasses. Let's put that one aside. The language. They write something, something, something. I can't even pronounce it. How do I even understand what you have written? So today's symposium, I'm hoping that the discussion would lend itself to how friendly such a label will be for the ordinary Ghanaian. How visible, how I see warning labeling. But the warning itself is not visible. It's not, this is the whole bottle, the small label on the side. How can I even pick up that warning? So I was hoping that there will be a table either at the back or in the front here with different product samples with labels. So the meeting or the symposium will just both be theory and practical kind of, or visual kind of. So the group here can show a standard, proper, recommended label, and the one that is not recommended or can be improved kind of. I'm not saying that we are going to downplay anybody's product, no, but we are just showing the best example, okay? And then I looked at I'm not a nutritionist, I'm not a dietitian, I'm a nurse. So I look at the definition of nutrient profiling models. And it tells me that these are tools that categorize foods and drinks and their nutritional content. I was discussing something with a friend a few days back. And you know, the way we cook, by the time the food is ready, all the nutrients are they are dead, kind of, they are not. But Ghanaians, we like to cook the thing for many hours, all the ingredients thereof. At the end, we don't get any value out of it. So when I looked like the nutritional content, I was wondering whether that nutritional content in that labeled product, the content is there. And if the nutritional content is there, do I eat it raw, just like that, or I have to cook it? Now, if I have to cook it, at the temperature of what? For how many minutes or how many hours? It's a different story altogether. So not to belabor the point, I want to say that subsequent programs should be both hands-on with some pictorial. I mean, you can show the pictures, but when you can see it there physically, it also adds some other value that may not be on the slide. Before I leave here, Send Ghana, can you give us some money to fund research in this area? GAND, can we go into a collaboration for a project in this area? The other groups, what are your names? Let me see, and I'll call you one by one. Let me see the groups. You wrote the groups here. Send Ghana, FDA. You have a lot of money. You take a lot of money from people every day for products. Can we do some work in this area? It will be very important to provide the evidence. And I'm sure we are more than poised for this to happen. So, talk about Ajima. Asogli State, Traditional Council, what's your name, whatever name. Can you collaborate for us to do something? I mean, your official role is there, but your traditional role is also there. Our people need to have some change of mind and attitude and be more interested in what we eat. Where is it coming from? What is in there? How do we preserve it? What are the things we can pick up so that we can stay healthy and not go to the hospital? Before I also leave here, I want to commend the two departments and all the stakeholders, Send Ghana, GAND, and all the experts that have put this together. And we hope that our audience and those online, everybody will learn something. We also hope that we'll continue the learning with attitudinal change. I myself, Eunice, you remind me that I have to look at the label. I'm being very sincere. I don't look at the label. Because I'm in a hurry, you look at the time, you pen them. So you just pick, and then you go. And so on this note, we want to thank all of you for your time. We want to say that we are grateful that you came to the university, and we want to continue partnering with you. We want to continue discussing with you how we can work together. I just also want to say that, the nutrition for children, pregnant women, the elderly, based on your interest, we have people here who are pediatricians or pediatric nurses, and we are more interested in pediatrics. We have people who are also maternal and child, etc., etc. So if you are not interested in the general population and you want to do something targeted, we are also more than ready to partner with you. So on this note, we want to thank all of you for making time to be here. God bless us all.
Thank you. She's full of wisdom, and thank you very much. So that is my VC. Please, can we give her another round of applause as she takes her seat? Thank you very much. I understand that we have very distinguished people who have also joined us online. In fact, we are international. So we have very distinguished people who have joined us online through Zoom and also YouTube. If you have friends who are not here, you can send them the link as well for them to join and also join our discussions. I hope you have also taken part of the survey. We have QR codes around, and you also have links, and you can probably take part in the short survey. It should take just 10 minutes of your time. So, ladies and gentlemen, once again, we would want to welcome you to today's symposium. Just in case you just joined online and you are wondering what is happening, we are currently at a symposium at the University of Health and Allied Sciences, and there's a collaboration between very great institutions. We have GAND, Ghana Association, Ghana Academy of Nutrition and Dietetics, my mother professional body. We have St. Ghana. We also have the Department of Nutrition and Dietetics and Department of Family and Community Health in Hohoi. In addition to this, we have very distinguished people from industry and also from service and also academia. And please, with all due respect and all protocol observed, we want to move to the next segment. So VC has actually set the stage for today's discussion. Well, have you ever wondered when you walk to Lecture Mall or probably to the shop across the street, what is written on the labels? Our VC has given us really good food for thought. Today we are going to have presentations. Today we are going to have presentations to discuss this and come to an interesting conclusion, what we need to be aware of and what is going on in terms of this field.
Okay, before that, I'm sure that we are itching and eager to receive the presentations, but our wonderful VC has to step out into another activity. But we cannot let her go without taking a photo opportunity. So we will ask the front table, the front chairs, those in the front row, to please get to the back, and then we'll take a photo opportunity with VC. Maybe we can pause for a minute or two and do that. And whilst we are doing that, we should be doing the survey.
Okay, they'll come in front.
They'll come in front. Okay, so we'll do the photography here. And then whilst you're sitting or waiting for your turn, it is very, very important. Honor must be given to whom honor is due. And you must have time for our VC to take photos with us before she leaves. So we must understand and have to take the photographs with her before. So we'll ask the front row and to take
we have lecturers from the other department, other heads of departments.
Yes.
Dr. Afeke.
Invited guests.
Invited guests.
Ghana,
yes.
FDA.
Ghana reps, Ghana Health Service.
Yes.
Please, All invited guests.
All invited
yeah,
guests,
please come
take
forward.
the photo. This will go into archives as...
please, all lecturers at the back.
Yes. Please join us.
Dr. Deku, we'd love to see you in the pictures.
So after this one, all the students can join at the back so that we take a group photograph with our VC. You have not taken a photo with VC before. Take advantage. And take a photo with VC. Yes. Okay, can the student body please join in? Everybody can join in, please. Please let them join in. Can we please keep standing? Whilst as many as can go on the stage will join in. We have to get a full feel of the participants that were present. It's a small program. It's a gargantuan program. Very good. Photo opportunity. Don't miss it. Get to the back, please. Climb up. Climb up. Don't squat. Photo says don't squat. Please get to the back. Some of you are not coming in the photo. Very good. Let's go. All righty. Can we take the last one? Say cheese. Say you are. Thank you very much. Please resume your seats. Thank you so much. Thank you, VC.
Hello, as we take our seats, I just want to quickly chip this in. You are, just in case you need to attend to any call, HS call or anything, or use the washroom to powder your face and all.
No phone call.
No phone call.
No phone call.
No phone call.
You can attend to phone call.
Yeah,
too.
but we have
you said every call.
Every
call.
Okay, no, okay.
Every call is a call.
It's a call, right?
The calling of God can also come upon your life.
But we have a TikTok generation sitting behind the WhatsApp generation.
Really?
Oh, yes.
Okay.
So please, if you need to use a washroom, it's just on our left or your right, just at the corner, and you'll be attended to. If you are not too sure, you need help, water, everything you need, today we'll provide. We have Dr. Nyasoji and RD Mensa. Can we see your hand up?
Yes.
Please, so those, can we see you up too?
Yes.
So we can see you. If you have any need, please see them and they will help you out. Thank you very much.
Please, I want to appreciate and acknowledge the school officer for the School of Allied Health Sciences, Dr. Emmanuel Prempe. A round of applause for him, please. Very powerful guy. The engine behind the school.
Yes.
Can your school officer be a doctor?
Intense.
Only in stars.
Yes. So at this point, we would want to, we have something for you. Okay. We have something for you.
All right, so I wonder if you started feeling the pre-survey, pre-symposium survey. It's very, very important that you feel it. So I want to give you a minute or two. The QR code is available. I hope you're feeling it. Are you? If you are doing it, give me a wave. It's very, very important. The QR codes are pasted around. So in a minute or two, you can just tap in. I can break the session for you. It's very important that we do this. So where are the QR codes? They're outside? Inside? Okay, by the walls. The QR. Please rise and get to the walls and scan the QR code and then let's continue. It's very, very important that we do this. It's a so we cannot go into the session before you start. So I'm giving you 2 minutes to please rise and get to the QR code and then fill the pre-survey form for me. I can't see you rising, please. Please rise and get to the QR code. Tap the QR code on. We are in a new generation, technical generation. Okay. So we are doing the before now. All right? Oh, you didn't rise, oh, madam. You've already done it. Oh, Charlie, put your hands together for these people. They are too much. There are too many much more. All right. So we are doing the pre-survey, pre-symposium survey, and we will do the post-survey after the program, or at the tail end of the program. So if we are ready to receive the first message. We will take the purpose of the program from the Secretary of GAND, the mother body for all dietitians and nutritionists in Ghana. Please, with a resounding round of applause, can we receive Mr. Joseph B. Dankwa and Sembono Lay. Thank you, Mr. Dankwa.
Please permit me to stand on the existing protocol. It's an honor to stand before you today as we convene for yet another significant discourse on Ghana's food environment and the urgent need for the front of package warning labeling, FOPWL. This symposium marks the next step in a series of engagements dedicated to advancing food policies and public health. Before I proceed, I bring you warm regards from the president of the Ghana Academy of Nutrition and Dietetics, who wishes he could be here in person. He extends his best wishes for a successful and impactful discussion today. Our journey began at KNUST, where we ignited conversations around front of package warning labeling and its critical role in shaping healthier food choices. We continued these discussions at the University of Ghana, further strengthening the evidence and advocacy for robust food policies. Today, we are privileged to partner with the Department of Nutrition and Dietetics and the Department of Family and Community Health at the University of Health and Allied Sciences to deepen the discourse on how food labeling can empower consumers and the general population to make healthier dietary choices, and ultimately reduce the burden of non-communicable diseases in Ghana. The need for mandatory front-of-package warning labels has never been more pressing. Ghana's food environment is rapidly changing with an increasing prevalence of ultra-processed foods that are high in sugars, salts, and unhealthy fats. These dietary shifts have contributed to the rising burden of non-communicable diseases in Ghana, such as obesity, diabetes, and hypertension. Research has consistently shown that FOPWL helps consumers to easily identify unhealthy foods, and that leads to consumers making healthier food choices for improved public health outcomes. As nutrition and public health professionals, researchers, policymakers, and advocates, we have a shared responsibility to influence food policies that prioritize the well-being of Ghanaians. This symposium therefore serves three key purposes. on knowledge sharing to present the latest research on nutrition profiling models and its impact on public health. On stakeholder engagement to foster dialogue among academia, research and health professionals, policymakers, and students to shape Ghana's approach to food labeling. And on actionable policy to mobilize voices from the scientific and health community to influence policy adoption and effective implementation. As future dietitians, nutritionists, and public health advocates, you will have a pivotal role to play in ensuring that the food environment supports and not undermine public health. This discussion is not just academic, it is about saving lives of Ghanaians. I urge all of us to actively participate, challenge perspectives, and contribute to shaping policies that will create a healthier food environment and food system for Ghana. Once again, I extend my deepest appreciation to the University of Health and Allied Sciences for hosting this important conversation. And to each of you, thank you all for being here, and I look forward to an engaging and productive session today. Thank you very much.
Please keep clapping. Thank you very much. Honorable Joseph Boache Dankwa. And honorable because he's the secretary of GAND. As I mentioned, that's the mother professional body for dietitians and nutritionists in Ghana. So at this point, he set us thinking, I'm sure. We have questions on our minds. What is food? What is... Okay, let me see. I don't want to probably mispronounce anything, so let me see. Front of package warning labeling. For some of us, this may be the first time we are hearing this, but we have very distinguished people who would give more insights into this, and also nutrition profiling models. It's going to be an interesting day today. To do justice to the next topic, we have Ms. Baba Sam. Ms. Baba Sam, are you here? Okay, so let me just quickly say something interesting about Ms. Baba Sam. I'm sure we're all curious to know who she is. Ms. Baba Sam is a key member of GAND, and also she represents St. Ghana. She advocates for policies that promote public health nutrition, and she plays a pivotal role in front and FOPWL, advocacy movement, ensuring that consumers' rights and labeling reforms align with public health. She did want me to introduce her before she comes. She's quite eager to share with you what she has for today. So at this point, we would want to give a clap and welcome Ms. Baba Sam. Okay.
Good morning, distinguished ladies and gentlemen. Thank you for giving me the opportunity. As introduced earlier, my name is Baba Sam. I work with St. Ghana on the mandatory front of pack warning labeling project. Okay, so I would like to get us thinking a little bit. In implementing this project, we came across this research, and it was done in Ho, and it was amongst drivers. They wanted to know the consumption and prevalence and awareness and the potential health implications of consumption of energy drinks. There were two things that I found very interesting in this study. The first one was that about 32.2% of the drivers were drinking 7 to 10 bottles of energy drinks a week. The second part of it is that 72% of them had poor knowledge on the side effects linked with energy drink consumption, as well as the ingredients for preparation. And this is where we make our case that the average Ghanaian is either a driver, a maid, a teacher. The average Ghanaian is a seamstress, an artisan. And if this study was conducted within the average Ghanaian population, and they are consuming energy drinks 7 to 10 bottles a week, that is alarming. For instance, in Accra, as early as 7 a.m., you would have drivers and their mates drinking energy drinks to get more energy to do their work. When you go to Kantamanto or our average Ghanaian society, it is easier to have access to sugar-sweetened beverages than it is to even get food. Before you are able to get food, somebody has to show you some woman in some corner somewhere who is selling orange or banana. It's quite difficult, and sugar-sweetened beverages are easy to get access to. We are saying that the average Ghanaian population, you and I, should be given the chance to make healthy food choices for themselves. We should be able to identify the nutrients of concern without even having to read the back of pack label, because it is very difficult for us to comprehend. As before I studied nutrition, I did not understand what the back of pack labeling meant. The ingredients are there, 100 ml means this means that. It's very difficult to understand it. But then when the front of package warning labeling comes in, it is an avenue for you and I, the average Ghanaian who is sitting at the market woman who does not know what 100 ml means, who does not know what all these complicated nutrients they write on the food warning the food package means. It is very easy for them to be able to identify these foods and make informed decisions for their health. In Ghana, there are a lot of researchers here, and we know that the research has found that 67% of school-age children are either stunted, underweight, or anemic. And it's very alarming. If we are taking our children to school, we are paying a lot of school fees, we are putting a lot into it, and then your child is either stunted, underweight, or anemic. Anemia is very alarming for me because in Ghana, when you start having a headache, it's paracetamol. If you are feeling feverish, you have malaria. If you are feeling dizzy, I think it's malaria, then go and buy medication. However, if children of school-going age are anemic, some of the effects of anemia is that you are feeling dizzy, you are drowsy, you have a headache, you cannot concentrate. So you have a number of school-going children who are not able to concentrate in class. You have a number of school-going children who have headaches. And then the first point of call if you have a headache is for your parents to give you paracetamol. And so it's very alarming if we are looking at the figures here. We are saying that the government of Ghana initiated the school feeding program. We all know the issues that come with the school feeding program. And the idea behind the school feeding program was excellent. And it was to provide one nutritious hot meal for a school-going child. But however, we realized that there were issues with the school feeding program. Because if I am coming to school and you are giving me food that is energy dense and nutrient poor, it means that yes, I am coming to school. You are getting high enrollment, but then I am full, but I am not nourished, which means that they are eating a lot of food. Yes, they are full, but at the end of the day, the nutrients they need to promote their health, to promote growth, and prevent diseases, they are not getting those foods. And it becomes an issue for us as a country. Ghana implemented some policies, as I was saying. So we had the school feeding program. We had the national guidelines for nutrition-friendly schools. I was a nutritionist in a private school for some time. And one of the things I did was that I adopted Ghana's nutrition friendly school initiative into my school. So there was the fruit day, fruit and vegetables day. There was the, so on those days, what you do is that you bring food. So it was twice a week. And we implemented it for some time. And we had parents coming to us telling us that the incidence of diseases with their children had decreased. And that is a very good thing. I just took an initiative that Ghana Health Service was implementing and adopted it for my school. And it worked for me. With Ghana Education Services policy, we know that there was this policy that you are not supposed to sell sugar sweetened beverages, toffees, candies in the school. However, it was defeated because the children are coming from the house with the sugar sweetened beverages in their bags. Their parents are actually buying it for them. In fact, now in Ghana, it has become like that when you give it to your child, it means you care about your child. And so a parent will go for a funeral, and when he or she is coming back, she would reserve the sugar sweetened beverages, the snacks for the child, because it shows that, oh, when mommy went somewhere, when daddy went somewhere, they bought me food. At the end of the day, you have a 2-year-old child, a 3-year-old child, drinking a whole bottle of sugar sweetened beverage. And it becomes a problem. You would go to school, there's a policy that you are not supposed to sell sugar sweetened beverages in the school. However, just behind the school gate, or before your child is coming to school, it's already in the child's bag. So we are doing a course 90 work after all. So yes, Ghana has done well, initiated some policies. The policies were good. However, implementation became a problem. So this is where our front of pack warning labeling comes in. The objective of our project, in short, is that we want the average Ghanaian, no matter who they are, you do not need to go to school. You don't need to be so learned to be able to make informed decisions about your health. The average Ghanaian should be able to identify the critical nutrients of concern, that is fat, sugar, and salt. You should easily be able to identify it. They should easily be able to make critical decisions. And we hope to achieve the policy, by September 2025. Now, there are a number of FOPLs that have been adopted in different countries. A country like Chile, for instance, adopted the mandatory front of pack warning labeling. So we have two types. We have the voluntary and we have the mandatory. For the voluntary, you decide whether industry decides whether they want to implement it or not. The policy is there. For mandatory, it is quote unquote by force that you do it. And so what we want Ghana to do is to adopt the mandatory front of pack. Why are we saying we want Ghana to adopt the mandatory front of pack? This is because, I'll just give one example. When I was coming, we arrived yesterday, and on my way, I was with my boss, and I saw an advert for a sugar-sweetened food. And immediately I saw it. I was like, oh, I want to eat this food. Throughout the journey, I wasn't thinking about it. But nowadays, we have adverts everywhere. That is advertising sugar-sweetened beverages. Already on the radio, on our TV, on social media, you are already conditioned to want to eat the food. If you present something to someone over and over again over a period of time, it becomes part of you, that when you are hungry, oh, if I get out, eat pizza. If I get out, eat this. If I get out, eat that. The first thing that comes into your mind is junk food. It's not your local yam with your contomme. It's not that, because you've been conditioned by social media, you've been conditioned by your television, you've been conditioned by adverts everywhere, that should be your first point of call. And I think that, and we think that it is a problem and it is alarming. So that is why we need mandatory. What the mandatory does is that there are different labels. We would want Ghana to adopt the label that is easy to understand and easy to read. For instance, when you look at the one with the traffic lights, for instance, it's great food from healthy to dangerous. So when it is labeled red, for instance, the E, you would know that the food is, let's say the fat content in the food is high. However, some of them clumps all the nutrients of concern together. So for instance, if you have the traffic light and it grades all the nutrients in the food as D, or it grades all the nutrients in the food as A, you are not able to easily identify whether the food is high in fat, is high in sodium, or is high in sugar. However, when you look at the warning labeling over there, it is very easy, because what it does is that it categorizes the nutrients of concern. So you have your fat, you have your sugar, you have your sodium. So if the food is high in fat, it's stated there that this food is high in fat. If the food is high in sugar, it's stated there that the food is high in sugar. If it's high in sodium, it's stated there that the food is high in sodium. And research has shown that countries that even adopted the voluntary front of pack, it has helped them. However, industry was able to find gaps in the policy to make it not so effective. But then with the mandatory front of pack, you are mandated to put it there. And then it makes it easy for the average Ghanaian, whether you've gone to school or not, to adopt that policy. And there have been talks upon the engagement with stakeholders. Some are even suggesting that we can use our Edinkra symbols because it has meaning, and the average Ghanaian is able to, when you see the symbol, you know that it means this. Or we can use different colors because in Ghana, red means something to us, yellow means something to us, or green means something to us. So we are having talks on how we would adopt the front of pack warning label. We are working with various stakeholders. We have government institutions, Ministry of Health, FDA. We are working with Parliament. We are working with academia. That is why we are here today. We are working with civil society organization. We have Ghana NCD Alliance there. We are working with WHO, UNICEF, the World Food Program. We are working with media. Somewhere last week or two, we trained journalists on why we should adopt the front of pack warning labeling, and they came up with interesting information, and they were very interested, and one of them was able to publish a story on it. These are our main activities. We would review Ghana's current draft on the NPM against best standard and develop an advocacy strategy. We would also review the front of pack policy being developed by Ghana. We would make recommendations because there's actually the front of pack warning policy is being developed by University of Ghana and the HD for H, a Healthy Life for Healthy Diets team. And so we would review the front of pack policy that is being developed. We would make recommendations. And so that is why we are having the symposiums and we are having stakeholder engagement so that we match it against the global best practices and we are able to make informed decisions. We would develop a guide on industry interference on public health. Industry interference meaning that immediately you say that you want a front of pack warning policy, it becomes a problem because it means that industry would have to reformulate or they would fight against you. And so one of the things we want to do is to develop a guide for industry interference. Our next speakers will speak more on the industry interference. We would organize training sessions, workshops with several groups to support advocacy of the FOPO, which we are doing. We would produce a study report which analyzes the school food environment, and we would make recommendations for amendment to improve the existing policies. We are working in partnership with GAND and Send Ghana, of course. We are saying that the average Ghanaian should know what they eat. Thank you very much.
Thank you so much. A louder round of applause would do, please. Oh, can I hear a loud one? Thank you very much, Miss Baba Sam from St. Ghana. And we are so grateful to you for doing this. I think it's a very noble cause, and for putting your monies and your energies into it. It needs commendation. I saw a research paper from one of our own. I saw Prof. Ni Kolekote. I think it's a good time to clap your hands. Announce it. I saw Mr. Peter Nuro Amayal's name there. Wow. Isn't it powerful? So we are taking a cue from what VC said, and we are going to have a lot of papers and publications in that regard. It's powerful. Awesome. So we want to move on to the next presentation. But before that, I remember when I graduated fresh as a dietitian, I would go to Accra Mall, and I'll go with a notebook, and I encourage all my students to do that. And I'll take the labels of all the products, and I'll write carbohydrate content, protein content, of all the major, because these are the things we interface with when we are counseling. And so for us as dietitians, labeling is not a joke for us. Says here, we said that we should bring it from the back to the what? The front. And it should be what? Mandatory. It's powerful, Papa. What do you think? It's very powerful. So we are hoping, if they do that, it will help our profession. Anna? Yes, it's powerful. Okay, so let's proceed. Let's proceed to our next presenter. And this man is one that needs no elaborate introduction. He's a loaded man, a man who is acknowledged and appreciated internationally. He is a sought-after speaker and conference presenter. He's a renowned physician, scientist, and public health expert at UHAS. He's advised global organizations like FAO, the African Nutrition Society. He's a pivot of the African Nutrition Society. Our people don't want introductions, but we will introduce them. And his work bridges science, policy, and capacity building in nutrition. Ladies and gentlemen, a loud round of applause for us to receive Professor Paul Amuna to present to us on Ghana's food environment and FOPWL. A louder one, please.
Thank you so much for that introduction. I like the way you've been trying to make the whole session lively. And I'm very honored to be here. I would like to thank the Ghana Academy for Nutrition and Dietetics for the road show on making this front of pack agenda visible to Ghanaians and our friends outside of our shores. I note that my good friend and colleague, Professor Amos La, is to present on this. And in recognition of that, I have tried to borrowed a few from him, but to also truncate it. Dean of SAS, I thank you for hosting us and for the leadership that you are showing at your school. I also want to commend Dr. Kodo and the team here at SAS for hosting this. I think in the Vice Chancellor's remarks, she made some very, very important points, which I think, I hope the organizers from Ghana have taken note of. As was said earlier, we've been to KNUST, we've been to other places And that's why I call it a road show. And it is good to actually sort of listen and adapt and modify, bring some samples, and create that kind of atmosphere. And for our colleagues here, it would have been nice to have seen some of the work that people are already doing with regard to this. The Vice Chancellor and the Registrar had to leave us because they had some important meeting to attend. I would have hoped to have had them listen to what I'm saying right now, that what we are doing here is a very important national activity, and that is to promote health through front of pack labeling policy. And as an institution, as a university, our visibility internationally and our ranking depends on some of these things. This falls under Sustainable Development Goal 3, and we are contributing to the process of educating the public and supporting the government in its policy to improve and protect health. So on those opening remarks, let me see how best to tackle this. I note that we are running 1 hour behind schedule. And if you look at the topic, you find that there are 2 aspects. The pointer, I don't think is working. The light is not working. Light on. Oh, I have to. Oh, okay. Yeah. So there is the part which relates to the food environment, and then front of pack warning labels. And I had an outline for the presentation to look at the food environment context very briefly, and to look at the case for front of pack warning labels. And we have to get used to that expression when we leave this place. And then to look in the Ghanaian context, to talk a little bit about the policy development process, and also to look at some of the guidance that we use to work on this. Let me say up front that we are far advanced in developing a policy for front of pack labeling in Ghana. We are far advanced. This is work that has been going on, led by Professor Amos La, with contributions and support from various professionals, including from UHAS and also from the FDA, the Ministry of Health, and other places. So we are far advanced. And I want to talk of the food environment mainly in snippets in terms of health and economic burden of non-communicable diseases. Some of that has been said already. The statistics are there for all to see. For example, the Ghana Health and Demographic Survey of 2023 indicated that nearly 50% of women of childbearing age are either overweight or obese. I'm just using just one example. But we know the challenges that presents. And the question is that you do not wake up one morning and the following day you suddenly become overweight or obese. It is a process, and it is that which concerns us here. And there are differences in terms of socioeconomic groups. In the developed countries, you find that a lot of the problems relating to overweight and obesity are more related to those of the low-income groups. We were told earlier on about the average Ghanaian and what they do. And so it is along those same lines that we are talking about this. Not only that, we don't only talk about obesity and overweight, but ladies and gentlemen, today in Africa, cancers have become a major issue, and it is getting worse. So that brings us to our dietary intakes. And we were showcased earlier on by Sen Ghana on the consumption of energy drinks. We call them energy drinks. They are advertised on television. They are advertised everywhere. And people buy them and take them because they believe that they will help to boost their energy sources. It will amaze you to know that if you take just one 330 ml can of any of those sugar-sweetened beverages, you will have about 14 teaspoons of sugar. 14, 1-4. Anyway, so, and I recall that in the Vice Chancellor's remarks, she was talking about packaged foods, and she was wondering, we are talking about packaged foods. What about the unpackaged foods? And I can tell you that in developing front-of-pack labeling policy, we have been reflecting also on a stepwise approach where we will have to look at unpackaged foods in restaurants and other places as part of the process. But it's a long process. Sugar-sweetened beverages, I want to commend Professor La and his team for the work that has been done to have the sugar tax in Ghana. Ladies and gentlemen, one of the reasons why the sugar-sweetened beverages and the biscuits that we buy are so expensive is because there is a sugar tax in Ghana. And some of that work was done by people who are in this room. And then there is a question also that Sen Ghana posed in terms of, and the Vice Chancellor was asking, how many of us know and can read and understand the labels, and how many of us are influenced by food labels when we are purchasing foods? Our level of nutrition and health literacy in Ghana is low. And there are a lot of people peddling all sorts of manner of treatments and things on television, radio, and everywhere. Some of them, they just go and get a degree somewhere you don't even know, and then they call themselves dietitians and nutritionists. Some of them sit in the studio and they put stethoscopes around their necks, and then they start to peddle their wear. And so we are being influenced so much by a lot of these things. And so nutrition and health literacy is of concern to us. After all, if we have front-of-pack labeling policy, and even if products are being labeled and people are not educated to know the meanings of these labels and how to use them, then our job is cut out. So all of us here, I believe, have a role to play, and especially with the students and the young people who are coming up, I hope that you see this as an opportunity for you not only to learn, but also to go out there and to apply. So I put this in, but you cannot see it. And it just shows you the processes involved in developing policy and how to communicate the policy in relation to anything, such as food labeling. And I'm not going to bore you with it, except to say, first, you have to identify the problem. And when you identify the problem, you've gone through the processes, and you get to the end. You have to have a system for implementing the policy, and that also comes at a cost. And then you need to build the capacity of those who are going to implement the policy so that we can sustain it. And then, of course, from time to time, you monitor and you evaluate the policy. Just to show you how far we have come, the policy development process is very complex, and it goes through a lot of hoops. For example, we have the ministry who will be the owner of the policy. We have the MDAs. We have the National Development Planning Commission, which usually is a key player. We have the cabinet, and then we have the president's office, and then it goes to parliament, and then parliament has to approve. So it's a very long process. So send Ghana, Guy, Gand, all of us who've been working hard at this. It's a long process, but we'll never give up because we believe in health protection in this country. So what is the case for front of pack labeling? First of all, food labeling policy is very, very important in empowering consumers and combating non-communicable diseases on a global scale. There is a lot of evidence to that effect. But for food labeling, effective food labeling, particularly when we use what we call the interpretive labeling approach, there is a huge potential to help consumers to have a better understanding of, what they purchase, and then of course to also look at the nutritional quality of the foods. And so recognizing the paramount importance of informed consumer choice, both national and international strategies have been developed in order to address these issues. In the Ghanaian context, the government over years has intensified its efforts to enhance awareness and address deficiencies in our food labeling processes. Ghana is currently in a state where, even though there is the desire and interest from government, we lack a unified national food labeling policy, and this hinders effective coordination and evaluation. So the development of the national food labeling policy has been one of those key, approaches to addressing the gaps in this regard. And so led by the Ministry of Health with its agency, the Food and Drug Authority, who are here and who are partners in this journey, we embarked on a lot of work that we did with stakeholders, a lot of workshops, a lot of technical group meetings that has brought us into a state where we can now come out and showcase and promote this whole approach to improving our diet and health. So we drew insights from various sources, from literature, from doing situational analysis, and also learning from other countries and their examples, their journeys, and through these processes, we have come to a state where we have a document, a working document, that we want to push for the Minister of Health to carry to Parliament for them to do the needful. So front of pack labeling, or as we have mentioned here, front of pack warning labeling. The reason why some of us prefer to use FOPL instead of FOWPL is that when you put the W, it means you are emphasizing the warning. But we want a food labeling system which encompasses both the warning as well as highlighting the good things that you might have in certain products so that it will inform the consumer to better select those ones. So that is why we talk of front of pack labeling. And it can respond to a number of objectives. And for example, simply informing the consumer on the nutrient content of the food, communicating evaluative judgments about the foods, and helping the consumers to identify products that are either healthy or unhealthy. So sometimes when you start like this, especially in developing policy, you start to have all kinds of arguments. What do you mean by healthy or healthier or unhealthy? So in developing policy, we have to have a glossary of terms where we define every single key item that we know somebody legally will try to make an argument over it. Remember that a lot of the time, a lot of the foods that we purchase that are packaged come from the food industry. And when you are developing policy to protect human health, and where the interest of the food industry is concerned, sometimes if you are not careful, you end up with some legal fights, and we are well aware of these. I can also tell you that the food industry has an interest in what we are doing, and they've been trying to find ways to engage some of us in some of their discussions in order to understand what we are trying to do. All right. So, what are we doing? Are we working from scratch? The FDA team that are here are going to be talking more about this. And my job is to set the scene for the rest of today's discussions. So we already have existing policies. And ladies and gentlemen, we stand on the authority of the Public Health Act of 2012. And in the Public Health Act of 2012, one of the overriding interests of government is health protection of the population. And so when we take the word health protection, we try to interpret it in the way that best suits what we are trying to do. There are other laws and policies, such as on breastfeeding promotion. We have the Codex Alimentarius Commission, which is a global body which actually has an oversight kind of a role linked with WHO, FAO, and others who actually try to be the policeman for the world in terms of laws and how we interpret them. The World Trade Organization and all these various bodies are very important players. But enforcement of nutrition labeling guidelines and standards for prepackaged foods are something that the Food and Drug Authority have been doing. In actual fact, they go around, they have their officers, and sometimes they go around and they have to seize or tell people to stop promoting whatever they're doing. And I'm sure you are aware that a lot of products, when they come on television, they have to put a label indicating that it has been approved by the FDA. My personal beef with the FDA and my fight with the FDA, who are my friends, has always been, why do they have to say verbally in a television or radio advert that this has been approved by the FDA? That is an indirect way of promoting their products. In other words, if FDA has approved, it means that it is a good product. Are you with me? The food industry is very clever. We have to be more clever or cleverer. And so implementation of the National Food Safety Policy, the FDA actually championed the development of the National Food Safety Policy, which is now in force, and I'm glad about that. But the focus of that policy is on food safety. But we are talking about nutritional quality, nutritional safety, and the risk of non-communicable diseases as a result of the overconsumption of products that are not necessarily healthy. And what are some of the gaps? FDA, I'm sure, will tell you about some of the gaps that they have identified in their processes. For example, the advertisement guidelines limits definition of food to prepackaged foods. So they can only kind of, focus on prepackaged foods. And there are special provisions for 2 of the dietary-related NCDs that are implicated in, these problems. Alcohol and energy drinks. So the energy drinks are covered in a way, and alcohol. However, there is nothing on high fat, there is nothing on salt, and there is nothing on sugar. I remember my father-in-law had high blood pressure, and he was told not to take salt. And he was actually from the catering background. And then they prepared the food, and then when they served him, I happened to be visiting. He said the food is tasteless. Ghanaians love our salt. But salt can be very dangerous. And so some of these gaps we've tried to address in the labeling thing. So in developing this food front of pack labeling, we sought to look for some guidance, and UNICEF and others have been very instrumental in developing guidelines, because UNICEF's primary interest is in overweight and obesity in children. And you know, when a child is obese at the age of 5, the chances are that at the age of 15, they will still be obese. And that means that when they become adults, already there is a trajectory and the risks will start developing. I have seen at first hand in the Arab Gulf, children 15-year-old with non-communicable disease, with type 2 diabetes, 17, 15-year-olds. And it's supposed to be after 50. So that tells you that these are real. And so some of the work that Prof. La and co have been doing has been around this. Where are we headed, but how do we get there? These are examples. And I think during the presentation from St. Ghana, she showed some examples. Argentina, they have come up with some of these labels where they use words and so on. And ladies and gentlemen, let me just say before we get a little bit confused that there is a difference between front of pack warning or food labeling and the standard back of pack labeling, which we know is mandatory. So in the FDA standard mode of practice, the back of pack labeling is something that is mandatory. However, as we were told this morning, a lot of that is small print. You can't even read it and all that. So in answer to the Vice Chancellor, one of the things that we aim to have with front of pack labeling is that it will be bold, it will be large, and it will be readable, so that it will solve the problem of people not actually being able to read what is there. That's a very important point to note. And then we have examples from South Africa and elsewhere. We have examples from Israel and so on. And so that's actually, we'll revisit this if we have time in the end. But that brings us to the talk of nutrient profiling models. Ladies and gentlemen, when we say nutrient profiling models, and I believe Prof. La will probably be talking about this as part of his presentation later on, so I will not go into details. Then we are talking about a number of things. So if you look, for example, in the middle here, where we have the red, you know, we are talking about total fat, saturated fats, sodium, sugar, and so on. And then in the green column, now I'm sure already you can begin to see red, gold, green, just like the flag of our country. That the green part is usually the freshness, life. We have green colors, which means good health and vitality. And so the green column here, when you profile any food and you are looking at the nutrients, vitamin A content, vitamin C, iron, folic acid, and so on. So you see already we are seeing the traffic light signal type of approach. And so there are a lot of things that we take into account. And when you look to the right here, you find that we've got some numbers, 100 grams per something, and so on. It means that we can also use figures, numbers, to talk about how much, the quantity of what is inside the product. So when we are profiling any particular food in terms of its nutrient composition, there are a number of things that we look at. So we have the food category, for example, and then we have to quantify the ingredients that are in the food, and so on and so forth. So it is a process, and then in the end, we will be able to say, what should be put at the front of the label. So in developing the policy, there are a number of phases that we go through in trying to identify and labeling, foods according to where they are. The first one is the preparation phase. And here, in doing this work, we had to do some kind of landscape and contextualization analysis, and then identify what the public health problems are. Because if you don't know what the problem is, then you cannot talk about the solutions. And we also have to understand the existing nutrition policy context. For example, if you take front of pack labeling, it's just one part of the policy package recommended to address unhealthy diets. It does not solve the problem. It means that you need to embed it within your national public health policy for it to become meaningful, for it to become visible, and for it to become more operational. And we need to understand what already exists to help us. And that is why we had to do some desk analysis. We had to look at what was in existence in Ghana, the FDA policies in existence, the standard, back of pack policies, and where the gaps are to help us. And also we need the current political context. In fact, in our working groups, we had some members of the Parliamentary Health Committee as members of the working group. The reason is that we needed to bring the lawmakers in, they needed to buy into the idea, they needed to work with us, and through that process, we were able to make a lot of progress. So sufficient political and public support as part of the government's wider response to malnutrition is critical. So our engagement today, ladies and gentlemen, is partly to inform, to educate, not to entertain, but to also communicate so that you can also become advocates for what we are trying to do. And then once the need and feasibility have been established, development of a new front of pack labeling system can proceed. And we have gone through those processes. And at each stage of the process, it is important to consider, one, what we need to do, what needs to be done. And number two, who should be involved. And so in developing our front of pack labeling policy in Ghana, in the debate stage, one of the questions, the key questions that we asked ourselves was, should we involve the food policy, the food industry during the development phase? It was a very interesting debate. The final answer was no. And so we had a lot of stakeholders, the NCD Alliance, other groups that have interest, stakeholders, but for now, the food industry has been not part of the discussion. But they will become involved at some stage. The reason is that in Ghana, our goal, and I'm sure FDA will talk more about this, is to have a mandatory front of pack labeling policy. And so, determining country-specific aims and regulatory objectives, I don't need to belabor this point. I think I've made a point already about the importance of linking it to national policies, particularly health policy. And at the moment, the public health law is being revised, and the front of pack labeling team had the privilege to have an input into the new document that is going to be put before Parliament. So there are various examples. I'm not going to go into that for the sake of time from different countries, and I'll share my slides so people can use them. As I said, stakeholder engagement is very important. There are rules for how we develop front of pack labeling policy in terms of things that need to go on the pack, minimum size requirements so that people can see and people with visual impairment also can see, or even Braille can read. So these are some of the discussions we've had. There should be uniform placement of the label on the pack. And on the top right or primary display panel, exact colors and fonts with reference to recognizing standards. There should be space between different elements of the label. And there should be contrast between the label and surrounding packaging and so on. So, ladies and gentlemen, we have very detailed sort of specifications in terms of what is required to have that label. So it is something that we have been working on. And during the Q&A session, I'm sure we can answer some of the questions. So front of pack labeling, there are 8 major types that we have identified worldwide. Traffic light system, reference intakes, Nutri-Score, the stop signs, warning, health star ratings, choice program, healthier choice. These are all examples. And I'm sure by the end of the symposium, when you do your post-test, some people's answers will change. So these are some examples of the various from Argentina, from Brazil, Canada, Chile, Colombia, South Africa, Israel. So we looked quite broadly. And then, of course, there are setting of sanctions for non-compliance. We'll talk about that some other time, because the FDA is very keen that the mandatory approach will have to be followed, and they will tell you more about that. And we also, as a nation, have to notify the World Trade Organization about what we are doing, our laws, and all that. And then in the adoption and implementation phase, it has to be a comprehensive approach, stakeholder engagement, such as we are doing now, and getting everybody involved. And so this will be my final slide. So we need a broad coalition of civil society groups that can bring more light and legitimacy and attention to the call for strong FOPL. And I'm glad that we had somebody from St. Ghana who are so passionate in advocating for FOPLs. It is important that all those participating in the coalition are free from any conflict of interest. This is very, very important. And they also have a role in synthesizing research on FOPL locally and globally, which we have been busy trying to do. This symposium, ladies and gentlemen, is one of such examples of stakeholder engagement with academia and other interest groups, KNUST, UCC, UG, UDS, and others, that we will go around and try to get the nutrition fraternity, our students, our faculty, our researchers, and of course, our deans and vice chancellors to support what we are doing. So the Ghana Academy for Nutrition and Dietetics has provided and continues to provide leadership and advocacy in this business. And I want to use this opportunity to thank GAND for your leadership and for leading this process. So on that note, I would like to say thank you.
Thank you very much, Prof. Paul Amuna. That has been very, very, very insightful. And at this point, we have come to know that the wheels of advocacy and policy has already been set in motion. And hopefully, once it's set in motion, it should get to benefit the average Ghanaian, that is you and I, to make the right food choices. Interesting times ahead. At this point, we've had incredible insight, and now it's your turn. If you have questions, it's your chance to ask our experts. Now, we would open the floor for questions. We have Dr. Faith Agbozo, who is the head of department for family and community health. Yes. Hey, please, let me finish introducing you. So she's going to take the next session, and probably when we have questions, she would help us address that. Thank you.
Yes, thank you very much. In the interest of time, we want to go quickly to the question session. And also to mention that for those online, if you have any questions, please put it in the chat, and our IT team here will prompt us with the questions, and our guest speaker would do us the honors of answering them. So we are here to have engagement. We are here to have discussion. We are here to hear your voice. So we want to open the floor for any questions. If you have, thank you very much. I've seen 2 hands so far. Can I see them generously? For now, 4. So we'll start it off as the first round, and then after that, we'll come back again to the question sessions.
There's a microphone here. Yes. A full divine. Divine question.
I almost deceived myself into thinking I could speak for everybody to hear. Good morning, and thank you very much, Prof, for the presentation, and the lady from St. Ghana. From Prof's presentation, I get the impression that for FOPL, it's to warn as well as to advise or to give that information to, or to appeal, if I'm to put it that way. But FOPWL is essentially to warn. But my question is, why are we using FOPL, WL, when the intention is to be able to give the whole information so that people would make informed decision? Immediately you use the WL, meaning that whatever is happening, you may not get it. We are just warning you against something. But one way or the other, we may be appealing. And also I'm thinking that industry would, maybe the confrontation would get, if you are using FOPWL, warning label, will be stronger if you are using without the warning. Because if I'm in industry and you are telling me immediately, I hear of an advocacy and it's front of pack warning label, I'm like, these people are going to warn everybody against me. Although it may be warning, but if you change and use the without the W, they may want to rather sit with you. So I'm wondering why we are not running the road show with FOPL and using FOPWL. And I have a question, that is my first. I have a question also that is supposed to go to FDA. I was thinking there will be a session after their presentation, but there isn't a session there. There is a question, okay. Okay. Whether they are sanctioning some of the adverts that are going on, because we hear some of the things, and I believe that if they sanction some of these adverts, it would water down the effect of whatever we are putting, because if there's a red light, and with the advert says that sanctioned by Food and Drugs Board, I'm more eager to listen to what Food and Drugs Board is saying than just that little red light. Thank you very much.
All right, thank you. Please, let's take the second question.
Can they introduce themselves before they ask the question? Is it okay?
Okay.
Okay, so please, my name is Enam. I'm a student of UHAS, level 300. So my question goes like this. Most of the foods we have in Ghana are imported. So I want to know if the FOPL is going to only center on food products from Ghanaian industries, or with the foods that will come in from other countries. And then the second question is, most of the foods that the locals take are not, they don't pass through FDA. So how will the warnings help with those people? Like someone who takes atpeteshi or the local jeans, how is the person going to be warned? Thank you.
Thank you very much. The third question, please. I think it was on this row, yeah.
Good morning. I'm George Legbeje, a nutritionist from the region. My first question goes to Prof. We have a lot of policies, and when those policies get to those who are supposed to implement it, that is the final stage of it. You will find it on decks, cupboard, and the rest, and the policies doesn't get to the intended beneficiaries of those that the policy were designed for. So this particular policy that we are going to implement now, what are the ways or what are some of the things that we will put in place to ensure that these policies get to the intended beneficiaries, and what are some of the channels that we will put in place to make sure that these policies is communicated to the targeted beneficiaries? Then my second question goes to the Saint Ghana, the lady who presented. The first primary objective, you said you want to achieve it by September 2025, and you want the population to know the nutrition, the consent. So I want to find out what are the specific activities that you embark or carry out, and the specific targets, so that by that period we should know that these are the activities that are planned, and this is what we have able to execute, so that we can monitor the progress of whatever we are doing. Then the other question, I think the other context, the rationale, she focused on the school environment, but we know that where we find ourselves, the children or the school people don't make decision. It is the parents and then those in the community that make the decision. So even if you give the knowledge to them and they get home and their parents, the reward for good deed in our part of world is the snacks and then all those things. And you get to the various home and they are giving you those things as the reward and then the rest, because maybe the parent may not have adequate knowledge on all these things that will be teaching our school people and then the rest. So what are we going to do to make sure that they, as a community or as the parent, also knows the right thing to be done before it is being communicated to the student and be integrated into the school system? Thank you.
Thank you very much. The last for the session, please. Please just stand. Yeah.
Thank you very much. My name is Joshua Odnakachi, and I have some questions to ask. One is, how effective will this front of pack labeling be in reducing the consumption of the junk food and unhealthy food out there? Because even among we, the nutritionists and the dietetists, we still consume this food, and we will also give it to our young ones around us. So how effectively would the ordinary Ghanaian appreciate this and reduce the urge of buying this food at the open market? Yeah, that is one question I'm asking. And then second one has already been slightly asked by the young lady who was like, the imported food, would it also be monitored? But we are here to promote Ghanaian indigenous food. That will go to the FDA. Please, which measure is being taken in order to reduce most of these imported food, and some of them doesn't pass through the right channel, and yet it's there in the open market? Thank you very much.
Thank you. I would take the responses first from Posamuna and then from our Saint Madam Baba. Just to mention that the FDA, the response will be delayed to the session for FDA, so still can stay around to ask your FDA-directed questions.
Okay, thank you. Thank you very much for those very insightful questions. They are very helpful. The first one was about the use of FOPWL versus FOPL. And I agree with you regarding sort of using FOPL as a better way of doing it. The ultimate goal, when you read the policy when it comes out, our main focus is on helping the consumers to make healthier choices, informed, healthier choices. and to protect the health of consumers. And so that's the focus. Now, at the moment, a lot of the labeling requirements across different countries has focused on the warning approach. And that is why the W has been used. But we are saying that we want to move beyond that. And we also want, in this policy, to promote healthier options. And to do that, if we take the W out, then it allows us that scope. And you're right. One of the things that we are going to do with industry, once it has gone through the process, is that we are going to engage the food industry, and we are actually going to educate them. And some of them will actually end up redesigning their products in order to meet certain requirements. So that is, again, work in progress. You can see it's quite a process. And I'm from UHAS. Your question was about the fact that most of the foods are imported. That is true. So the point here is that is why, for example, as a country, the World Trade Organization needs to know that we have a policy and we have a law regarding front of pack labeling. So if anybody is going to import any food into the country, then they have to follow those rules. However, we want to focus also on food that is manufactured or packaged in Ghana. If we are able to set our home right, then it is easier for us to please the ones that come in from outside. I know there is smuggling and things coming from all over the place, but the FDA has a certain policy. I don't know how many people know about it. It says, if you see something, say something. This is from FDA. And I'm sure during their session, they'll probably talk more about this. In terms of the alcohol and things like that, you know, it is a very difficult one because traditional drinks at the moment, apart from those that are advertised on television, have you noticed that when they advertise and they say FDA has approved, they don't also tell you that certain groups should not consume? Even though they've written it there, it is not good for under 18 and pregnant women. They don't say that, you know. So there is a lot of work that needs to be done when it comes to local products that do not go through the FDA. Somebody in a village making akpateshi, the people are waiting. So before you go to FDA and come back, it's finished. You know, that is and it's quite true. So there are a lot of issues. There was the question also from George about implementation of the policies. And, you know, that is part of the reason we are having this engagement. Ladies and gentlemen, we are all part of the implementation. But you see, when you develop a policy, when you look at my presentation, the implementation side requires funding, money. You need to build the capacity of those who are going to implement. You are right. A lot of policies just sit on the table. I remember being in Qatar about 10 years ago, and we were dealing with primary health care. And I went to the managing director and I said to her, so how do you implement your policies in this country? And she was going, what do you mean? I said, well, it looks like you have quite a number of policies. I see that people have written very nice policies. Do your people know? Do you advertise this? Do you have social marketing programs? Do you educate people? Are you engaging with the schools, academia, so that they can train their students to be familiar with the policies, so that as practitioners, we are training health professionals. When you come out, you should be part of that process, even if you are not aware. Some people think it's just FDA. FDA is part of the equation, but not the whole thing. So it's another, again, it's quite a process. And I believe we can have some more conversations around these subjects. And there is also the question about the school environment. You are right. The school food environment is very important. In fact, there are some people in this team who have been working on the school food environment. Professor La is an expert on the food environment, and I hope that in his presentation, he'll throw some more light. We have recently been doing some work in Hohoe on the school food environment, and you are right. But the emphasis is on what I indicated earlier as one of the drivers: nutrition and health literacy. When the parents are educated and they know about nutrition and health, it will translate and it will be more meaningful. The teachers, our school health education coordinators, the school health promotion, all these are very, very critical. So you find that it requires a lot of stakeholders at all levels for this to be effective. And Joshua was asking about how effective the policy will be in reducing the intake of junk foods. The journey of 1,000 miles always starts with the first step. I can tell you that there are some country examples where the introduction of front of pack labeling has made a huge impact in terms of consumption. And usually when you slap a tax on some of these, now when you go to buy sugar, you are careful about the amount of sugar to buy, aren't you? And things like that. But it is definitely one that we need to continue working on. But in terms of effectiveness, in places like Finland, where nutrition education starts from the classroom, and then it goes to the school restaurant, and then the children go home. Believe you me, you see a 10-year-old and a 50-year-old, and both of them, their knowledge of nutrition and good nutrition is amazing. You go to Sweden, you have similar examples. In Mexico, obesity and NCDs used to be a huge problem, and the prevalence is coming down because the government has decided that it costs more. Ladies and gentlemen, it costs more to service our health system with NCDs than to prevent. Thank you.
Thank you very much. We'll take an answer to the question from Sen. Please, can we get her the mic kindly? A quick one. After that, we'll listen if there are any questions from our participants online. If there are any questions.
Okay, good morning. My name is Levlin Kunedu Asiedu, and I'm the project coordinator leading this project. So I'll take a few responses from the questions that have come. The first question that directs specifically to Sen Ghana is on the targeted activities. We hope to get this policy through by 2025 September, and the activities my colleague Baba mentioned includes sensitizing, conducting these kind of symposia, going through the zonals to get input from citizens. We are doing 5 zones across the country to when the policy is eventually in the public domain, to get citizens to look at what the policy is and what works also best for them. And we are collaborating with the FDA and all the institutions forming the technical working groups on the FOPL for Ghana. And so this activity is part of the sensitization. Like Prof has said, when our capacity is built, our knowledge does not have to remain here. We also have to go into the communities. And I know that as part of the community engagement, students go out to do some practical work. Please include this in your activities. I think that in designing the activities, you are allowed to come up with some activities yourselves are going to do. If you pick front of pack warning labeling, sensitization in the communities, you should be able to be part of the champions or the ambassadors advocating for a healthier Ghana. What this project seeks to do is to remove the burden on the individual looking out for his or her own healthy lifestyles, and giving the responsibility to government to give us a policy that already shapes our food environment. That way, when you walk down the aisle, you go to Davi's store, you go into Eno's store, you know that there is a policy, and more likely the items you are going to pick from the shelves have those warning labels to help you. So that is one of it. And then on the school food environment, what this project seeks to do is to conduct an assessment so that we will publish the report of the assessment. Like Prof has mentioned, a lot is going on in the food environment campaigns, looking at the school health programs. But ours is to do an assessment, and then we'll bring the report, use the report further to engage citizens to promote healthier environment within the school. So, Faith? She's my colleague from University of Ghana, so happy to meet you, Faith. And
thank you very much.
Duly discharged?
Yes, discharged,
thank you.
Please. I saw a hand up, and we want to be mindful of the time, but we want to hear your voice. Is there any other person beside this hand? Okay, too quick. Please keep it straight to the point.
Thank you. Please, I'm Talma Ajima, a women's organizer for Guta. Please, I want to know, we already have some existing products in the market that may not meet the standard of this policy. When this began, would they be scrapped off? What would they do to take off those products in the market?
Thank you. The next is the gentleman just by you.
My other question, let me add one more.
Please carry on.
In Ghana, I know politics has taken much of our... Politics is into everything. Should this start? I know there are politicians who have interest in some of these things. Maybe a product in the market that does not meet this criteria, and then they have to take it off the market. But a voice from a politician insists that they allow the product to still exist. How firm are people going to be to make this a reality?
Thank you. The gentleman, the GAN secretary.
Thank you. My question goes to Prof. So it's connected to the gentleman's question concerning moving with FOPWL and FOPL. I think we are advocating for the warning because of the high incidence rates of the non-communicable diseases. Just to lay the facts, the 10 most causes of death, out of the 10, 7 are non-communicable diseases, which makes it very high. And it is a reason why GAND and SEND are advocating for the warning signs. Now, for the FOPL, I know we are looking at both the nutrients of concern and the nutrients to encourage. Today, we have industries producing bouillon cubes, and they are fortifying the bouillon cubes with iron. So do we say that because of the iron, the population should keep consuming bouillon cubes, which we know are very high in sodium and have been implicated as the main risk factor for these non-communicable diseases? Thank you.
You have iron questions to answer.
Thank you very much. I don't know where you want me to start from. The structure of iron. Then we won't finish. Anyway, no, these are really very good conversations that we are having. And the first question was, Telma, in relation to products on the market that are short in terms of the quality, the standards, and what we are going to do about them. I would want the FDA to answer to that. But currently, the FDA also works to remove products that they find to be unhealthy on the market. And you know, sometimes products even are expired. You know, expiry date, and people still sell them and things like that. But in terms of what we are doing, this is a process. And once the policy becomes law, then, you know, FDA, they will let us know what their plans are in relation to that. And I'm glad that Guta is here because, as I said, at some stage, we'll be engaging with the industry, the trade associations, so that people will know our intention is not to scupper any industry or anybody's business. It is rather focused on health protection, consumer choice, healthier diets, making healthier lives. So that is the focus. Now, regarding the politics, we started this work in, I think, 2022 or earlier. You know, this work has been going on for some time. And so we have crossed from one particular government to another. As far as we are concerned, our work does not know party colors. And as far as the health protection of Ghanaians is concerned, anybody who stands in the way, that is why if you look, you find that civil society is very high up in our list of advocates. Send Ghana and others, they will come and we will go and we will march. So no politician can stop this, whatever their personal interests. One of the things that we are interested in at the Fred Newton Binker School of Public Health is to set up a nutrition analysis laboratory. Our goal is to train women who, produce, small scale, and we'll train them and we'll also analyze their products for them so that before they even get to the standards authority or FDA, they already have a certificate from us showing that this is the nutrient profile of their product to help them. So, in fact, in the end, the education from all sides and from industry will be very important. You see, you cannot go to a country like Sweden as a food industry and go and produce something that is against the government's law. It will not happen. Because they have set themselves such that they have standards. And we should also. Because why should we bear 85% of the burden of non-communicable diseases is in the developing countries, not in the rich developed countries? And believe you me, if you've had a relative who's had cancer and has had to go through a whole series of treatments, even just the, Prof will tell you, just the laboratory test alone. Somebody with diabetes, every week, the medication costs at least 1,000 cedis, just for the diabetes. We are not talking about the hypertension and the other comorbidities. So you are right. And in terms of FOPWL, yes, our emphasis is on the warning because at the moment, you notice that even when you go into the policy, what we are trying to do, we are trying to kill several birds with the same stone. But you find that it is very difficult to come out and label something as healthy. Somebody can have billion cubes and then they put iron in it. And because there is iron there and it is a certain concentration, they want you to say that, it is green. Meanwhile, there are other things there that are not so green. So in the policy, you find that we've tried to address some of those gaps. But the warning is very important. It is very difficult to make a health claim for any product. We don't want to open the floodgates for people to start claiming that their products are healthy and all that, even though you have heard it on television. And it is not the FDA who approved. Thank you.
Thank you, Prof. Some questions online for quick responses. Where can we get more specific indication on the types of the front of pack labeling choices? Where? I guess the question is about the source to get more information.
On the policy or on general
on
information?
The types of front of pack labeling.
Oh, okay. Thank you very much for that question. There are many sources that you can get information from. But if the questioner wants us to help with literature and things like that, there's a lot of information that you can get online. There are free sources that are credible. From UNICEF, for example, they have a lot. In fact, one of the key advocates for front of pack labeling is the Global Health Advocacy Incubator. And they have done a lot of work in this regard. We have borrowed a lot from them. So you can get, there are sources. We can, if you contact us, we can direct you
Thank you. So Prof has graciously agreed to share his slides, and I guess you find a source from there. Please, Prof, please don't sit as yet, because the next one is, what about herbal products, cosmetics, pharmaceutical products?
Okay, I think the FDA has a process for herbal products. And the herbal products don't necessarily qualify as food. And so because of that, when somebody has a herbal product and they want to market it, they have to go through certain processes. And I'm sure the FDA will be able to throw some more light on that. Thank you.
Thank you. The last question, I'm not sure who will be the right person to answer. Prof, you can please take your seat. Is how different is this project from the HD4HL project? That they seem to be seeing some alliance and conspicuous things happening.
Thank you very much for that. This project is part of that project. This project came out of that project. So we are very much working together.
Yeah, the last which someone whispered in my ears is saying, are you not being too overambitious with September 2025? Quick one, are you not being too overambitious as we run into the next session? While she answers, I take my seat so we prepare for the next session. Are you not being too overambitious?
The more you delay with these kinds of policies, the more you get industries kick back at you. So we are looking at a shorter engagement time so that the policy can come onto the shelf. Fortunately, a lot of work has gone into the policy before you are even hearing it, possibly for the first time today. And so we are miles ahead, and we are hopeful that when all this process comes through by September, we should have a document that we can wholly say that is holistic enough to come into the public. Thank you.
Thank you very much. Can we please put our hands together for ourselves? Powerful. We bring in the first session to a close, and we'll have a health break, a very healthy break, I believe, because if it's not healthy, well, we'll look. It will be very healthy. And I'm instructed by Efia Mankwa, who is a project officer for GAN, and Reverend Dr. Priscilla Amenya and Dr. Juliana Nyasoji, who are coordinating the health break, that we should remain seated whilst the snack is being shared for us. So we remain. If you want to use the washroom, you can do that, but please, let's not venture out. It's just a 10 minutes health break. We are going to zoom very soon into the second session, and that is very packed. We have weightier things to consider in the second session. We are going to discuss the food labeling and marketing policies in Ghana by FDA. We have the global evidence of what works for front of pack labeling and nutrition profiling models. And then we'll do something on policy pathways. What has led the run-up to the formulation of this front of pack labeling and nutrition profiling models in Ghana. And we'll have the state of Ghana's FOPL and NPM policies, what the citizens should expect. And then the part that I love most is going to be the panel discussion, where we are going to have FDA interface with GANT and SEND and UHAS professionals, even Ghana Health Service, to have a discussion. So we have a 10 minutes break for our snacks before we go on. But whilst doing that, lend me your ears, please. Lend me your ears, please. I want to acknowledge very vital personalities. R.D. Percival Agodo is in the house. Can we put our hands together for him? Yes, R.D. Percival is the immediate past vice president of GAND. So he represented the dietetics group of GAND, and his tenure was between 2019 and 2024. Very hardworking. Incidentally, he is a lecturer in the Department of Nutrition and Dietetics. Very, very powerful guy. We also have our own R.D. Daniel Mensah, who is a GAND governing body member and also the chair for the GAND Foundation. I see we have some HODs also here, HODs from various departments also here present. We want to acknowledge all of you for coming by. I see that we have some media houses also here. I hear Graphic Communications is here. They've told me that they have 44 pages already of write-up to publish. I see we have Joy FM also represented here. So this is a national, international, what I say, sort of program. It's powerful. Anna, what do you think? Is it powerful? Okay. All right, so in the next 10 minutes, we'll come back and then start the second session. Dollar.
God bless. We have come.
Hello, can we please have all those outside to come in? Ushers, can you please help us get all those outside to come in? I'm sure we enjoyed our snack. Did you? How many calories? How many servings? Somebody should tell us, one of the students. How many calories? Barbara. R.D. Barbara. You know how she was eating the banana? She was dipping the banana in the banana.
As we wait for the others to join us, we just want to solicit your mind on the packaging. What do you make of the packaging since we are talking of packaging today?
Packaging.
The context.
What do you think? Madam, what do you think about the packaging and the content? Can you please kill the music for me?
So I'm just in love with the package. Sorry. So I'm Jifa Ajono. I'm from Regional Health Directorate Nutrition Unit. And so I think I'm just in love with the packaging and everything. It's very good compared to most of our workshops that we attend, and they serve us pastries and the canned drinks, sugar sweetened beverages. So I think it's something we are also learning again and again.
Awesome. Thank you very
please,
much.
Thank you.
So this one is Charity Begins at Home.
Yes, please.
So we are taking the lead on healthy foods, and it's a good way to go. For our online participants who are wondering what is in the pack, we have fruits, granuts, and what else do we have in there?
I see banana here. 2 fingers, banana. Okay. 60 calories times 2. And then the apple. The apple is a small apple, dietetic apple. That one is 60 calories. So 60 plus 60 plus 60 plus 60. 6 for what? 24. Anna, 240. Hey! Dokrono ye do dokrono back home. And then the groundnuts, is it up to a serving?
Yeah, I think so.
It's up to a serving.
Yeah.
So how much calories? How many? This one is a mixture of oil and proteins more. Yeah. So what do you think? Add this.
Okay. I think some are saying probably we should make it another time.
Another?
They don't want us to put them on board.
They need their exchange list there.
Yeah.
Okay, all right.
So at this point, those who are waiting at the back, we really want you to come forward. For anyone who just joined in right now, and those who just also clicked our link online on our YouTube channels and also on the Zoom link, you are joining the symposium on front of pack warning labeling and nutrition profiling models. And it's a collaboration between GAND, SEND-GH, or SEND Ghana, Department of Nutrition and Dietetics, and Department of Family and Community Health. It has been a very engaging morning. We are getting into another session of exciting information as well. At this very point, we have a very distinguished lady. She wouldn't remember me, but I've worked with her some time back at FDA in Accra. And she was a great leader, and I'm sure we are all excited to hear from her. Her name is Ms. Denitri Ameflu. She's the Chief Regulatory Officer at the Food and Drugs Authority, the Volta region. She ensures food safety and compliance with Ghana's food labeling regulations. With a background in nutrition and biochemistry, she plays a vital role in implementing and enforcing food policies. At this juncture, I would want to invite Miss Adam. Miss Adam, are you the one coming? Okay. Oh, okay. Oh, we have an we have an able gentleman here. Sorry for that.
All right. That's fine. I think everybody is not oblivious to the fact that I'm not Miss Adam. Yes, I'm a male. So, my name is Bryce Agbli. I'm also a regulatory officer with the Food and Drugs Authority, the regional office. And I'll be presenting on behalf of Miss Adam. So, whatever I'm saying today is a representation of what she would say or what she would want to say. So, apologies. Standing on existing protocols, I would say it's a great honor for me to stand here today to discuss this critical aspect of public health and food safety, with specific regards to food labeling and marketing policies in Ghana. The issue has been very prevalent in the world, with the rate at which NCDs and unhealthy dietary habits have come up. And as we examine these policies, then that are in relation to regulating food labeling, I invite us for us to reflect, for us to deliberate on these implications for public health, industry practices, and consumer choices. As you know, Food and Drugs Authority, we are one of the regulatory bodies that have been mandated by the Public Health Act to work in the country. Our main responsibility is on focusing on consumer or public health. We are present in 11 regions. You know, Ghana has 16 regions, but so far at the moment we are only present in 11 regions. Some regional offices have oversight responsibility for other regions. So for Volta like this, we have oversight responsibility for the OT region. So let's just dive down into the presentation. This is the outline. I'll be talking on the global perspective on healthy and unhealthy diet habits, then promotional techniques that are employed by industries. These are based on results from adverts from 2022 and the NCD report. Then the role of the authority in regulating this food environment, sections of the guidelines that we use as the authority as restriction tools, then front of pack labeling or marketing restriction policies that we have in Ghana. I think most of the presentations that have been done today have done justice to the prevalence of these non-communicable diseases. It's evident in Ghana across a certain age demographic that obesity diabetes, hypertension. These sicknesses have become major causes of death in the country. And if you see the linkage between our dietary habits and lifestyle, these have been like the common risk factors that have caused these NCDs to spike up. So I wouldn't want to bore us so much down on the NCDs and its prevalence, since most of the discussions have taken over it. So I would want to state that the FDA works according to certain frameworks, and the authority is guided by the Public Health Act, Act 851 of 2012, to which mandates us to be able to do any activity in the country. And with that, we also collaborate with other agencies. So most of our food products that are in the country that have been registered by the Food and Drugs Authority have food labels. And these food labels, you realize that for it to be registered by the authority, you need to have an FDA number present on the package of the food label, be it a locally manufactured product or an imported product. So for you to have a label, that means that it's a key requirement that the authority places focus on. So in meeting this safety and quality requirements to protect consumers, we look at labels. And labels, I think, is forefront in what we are discussing today and what the policy is fully about. So labels, like I say, are legislative instruments. Labels are controlled by legislative instruments. So for you to have a label on your product, that means that you are following a law that is present in the country. It has gone through parliament, it has been approved, and that is what the Food and Drugs Authority is using to work. So the FDA labeling requirements are governed under the food labeling regulations, which is 1996, LI 1541. So for most people, there is a common connotation that, oh, FDA, we allow some products to come onto the market. So for you and I to be able to determine, ideally, this food product that I'm finding at Lecha, I'm finding at Melcom, has it passed through the hands of FDA? Has there been any regulatory action that has been taken on this food product? There is a critical need to look at the label. So if the label has all these components that I'm going to talk about, then there is a clear indication that, one, yes, FDA has done its due diligence on that product. So for every product, you need to have a product name. So every product needs to have a product name which should accurately reflect the true nature of the product. You can't have granules in a pack, then you call it sweet nuts. The name should be a reflection of what exactly is in that product. Most of these prepackaged foods have ingredients, and the ingredients must be listed accurately and clearly on the labels. We've seen some products on the market that you see that the labels are extremely illegible. The writings are very small. You can barely make out the labels that are on the product. Ideally, every product that is registered by the authority, on the label, there needs to be a net weight. So the quantity of volume that is present on that product, it should be clearly stated in its metric units. So if I have a bottle of juice, or let's say the energy drink that has been implicated in most of today's presentations, and someone writes 5 kg as a labeling, a net volume on the product, doesn't mean FDA has worked on it. It's likely an indication that, yes, the label is faulty, and there could be a problem with that product. So in its standard metric unit, it's supposed to be there. If it's a liquid, it's supposed to be in mils. So the name and address of the manufacturer, it is very important, because for our work, we need to be able to trace where each product is coming from, be it imported or locally manufactured. So if you don't have the name and address of the manufacturer, we will not be able to access that facility. The country of origin. So most of our locally manufactured products are from Ghana. So Ghana should be stated on it, produced or manufactured in Ghana. And if it's an imported product, it means that you need to state the country of origin where the product is coming from. And I would want the auditorium, everybody here, to know that for all imported products that are brought into the country, FDA moves to the countries of origin to inspect those premises where these food products are coming from. So we do GMP inspections, foreign GMP inspections outside the country to be able to ascertain that most of these companies that we are importing their food products from are GMP compliant. We have batch details or date markings that are supposed to be on the products, which will include the batch number, the manufacturing and the expiry number, the expiry date, sorry, and they should be clearly visible. So for this date markings that are supposed to be on products, mostly we've come up with a strategy. Some facilities or some manufacturing companies have dates that they already printed on the labels down. So you see someone has a product and he has printed 2,000 labels down, but the shelf life of the product is in 3 months. And the products are not able to be exhausted in those 3 months. And the labels are still there. There's a likelihood that they'll still use those labels to print other labels. So FDA has made it clear that those labels are supposed to be embossed. So when you have the embossment machine at your facility, you'll be able to just emboss the exact date that you do those products on the product. On those dates on the product, sorry. Then the storage instructions. So if you are using any specific or special means to safely ensure that your product still remains quality throughout its shelf life, you need to state that storage instruction. Then the nutritional information. So before you put any nutritional information on your product, you need to substantiate it by analysis. We work in collaboration with Food Research, Ghana Standards Authority, Water Research, Ghana Water, to be able to get certificates of analysis for this product. So when a product is submitted to us for registration, we take this independent certificate of analysis that has been brought to the authority. Then we also do our independent confirmatory analysis to be able to be sure that whatever you are bringing to us is in line with whatever the authority is also finding from its lab. Then allergen information. There are some people that are lactose intolerant. There are some people that don't like nuts. They get allergies when they take these food products. So in case you have it, you need to indicate it on the label so that consumers that are allergic to these things don't pick it and use it. Then claims and warnings. Professor has talked about health claims a lot. It is against the authorities' policy that you advertise a food product for any health condition. I'll take that again. I'm saying for the Food and Drugs Authority, you are not supposed to advertise any food product for any, claiming that it will cure any health condition. Food is food. So the nutritional aspect of it, yes, you can talk about it. But that it cures or it helps a disease, no. You will not be allowed to advertise it. Then there are other claims that you do and relevant warnings that you need to put on the label. If it's not suitable for children below 5 years, if it's not suitable for lactating mothers, all those things should be stated on the labels. So as we go ahead with the presentation, we've realized that there is so much information that is coming out about advertisement. These food manufacturers, they have strategies that they are using to promote their products. And you can't fault them. When I have a product that has been certified by the authority, I definitely have to put in ways that I can market the product. But the authority is also working in such a way that what you are marketing does not seem to target a specific group of people, does not seem to draw a line where you are going to put people at risk when they take these food products that may be unhealthy. So in 2022, we have an advertisement unit, and 3,367 advertisements were picked up to be registered for a year. So ideally, FDA, we renew advertisement registrations or licenses every year. Definitely there is room for new information, new research, new development. As such, if there is an advert that is on air, that is on print media, and there is a need for it to be upgraded because there is new information, then definitely you would need to put these things in place. So these adverts indicated that a lot of NCDs related issues constituted 57.8%. And that's over half of the adverts that were registered for that year. So it showed an alarming rate at which these promotional techniques have been used. And you realize that they use claims, promotional characters, price promotion. When I go ahead and show you some of these pictures, you see some of these promotional techniques that are used by this establishment. You see them using stars to promote some of these unhealthy foods. You see them using price promotion. Buy two, get one free. There are some pizza companies that every Tuesday they do double of whatever you get. And if you study the sales analysis on that day, most people buy on Tuesdays. Most people would purchase those unhealthy foods on Tuesdays because they'll get more. And that is what we are trying to draw out of the system. So most people will ask, what is the FDA doing in relation to all of these things that we've stated? What is our role as the regulatory authority? So we are putting in measures. Prof made a statement that this advert is FDA approved. It's an indirect endorsement for these companies. I want to make it clear to Prof that, one, before your food product is registered by the authority, like I made mention of, you have to undergo through a rigorous system of registration requirement. And these are in line with standards that have been stated. So standards from Ghana Standards Authority, then the codex that we use during our registration meetings. So if this advert is FDA approved, that means your product is okay. So there is a global action plan on the prevention and control of these NCDs, which the FDA is actively involved in. And we realize that there is a need for us to move in a direction where legal instruments can be used. Because if it's not in law, if it's not in policy, it's very difficult to enforce. So for this voluntary, for this policy, we had targets to reduce intake of salt or sodium, then targets to reduce the prevalence of blood pressure, and also targets to halt increase in cases of diabetes and obesity. And FDA, yes, we recognize that there are challenges, but we are also trying our best to play a key role in this promotion. So, in fulfillment of this mandate, the authority, we do a lot. And in these activities, through our food registration, regulation of adverts, implementation of those codex guidelines on nutrition and health claims, consumer education, surveillance, market surveillance, then food inspections. Then there is the research projects that we've undertaken, the adverts versus the NCDs, then HD for HL, Healthy Diet for Healthy Living, which I was an active member of that project that we've been working on. We went about this malls and shopping centers, and we identified prepackaged food products, and we took pictures of those labels. And with that, they would be able to profile, the nutritional profile, and be able to develop these FOPLs. So for us, in case of advertisement, we have some restrictions that we have. Advertisement should not contain target materials, which refers to recommendations from health professionals or scientists or well-known personalities. So Prof cannot be indicated in an advert where he claims that, yes, this food product has so and so benefits. No. Well-known personalities cannot make claims which can be used in this advert. Then you shall not target adverts at pregnant or lactating mothers. An advertisement shall not promote or depict excessive consumption of alcohol, which we are actively working on. Then any consumption promotional activity that encourages or is likely to encourage overconsumption of alcoholic beverages is prohibited. Then no professional or well-known personality shall be used in alcoholic beverage advertisement. We had a lot of challenges with this, where stars, prominent people, or influencers stood up against us that why are we saying that they should not promote alcoholic beverages? But we know what personalities do to the adolescent group or the teenage group, how people look up to people. So if you are endorsing some of these products that are not supposed to even be taken by that age group, what are we trying to do? So yes, we were able to do it. Then we were able to ban the airing of adverts, especially alcoholic adverts, from 6 a.m. to 8 p.m., where most of these people should be asleep. Advertisements that are targeted at minors, we've been able to work on it. So children's songs, cartoons, characters and animations, anything of that sort should not be used in the sugar sweetened beverages advertisement. Then alcoholic or sweetened beverage adverts shall not be used in children's magazines, newspapers, journals, especially when it's targeted at that age group. Then we went to the discussion on the front of pack labeling. I think most of the presentations have done justice to that, and we are a bit time constrained. But from what I said, FDA, we've been a key part in this HD for HL project, and we are also advocating that, yes, we would be a part of this front of pack nutrition labeling, whether warning or just the labeling. Anything that the policy brings up, we would make sure to enforce it. And we already know the importance of what these FOPLs would do. We've already had a look at some of the FOPLs that are being used. And when the policy takes place and they decide on the specific ones that us as a country, Ghana, that we are supposed to use, the authority is open to having dialogue with the food manufacturers or these food producers. Then when it becomes law, we will be able to enforce these activities. So the FDA, with the support of its stakeholders, is committing to promoting healthy diets and reducing NCDs in Ghana. We've reviewed our guidelines in relation to labeling and advertisement to address some of these NCDs related issues and to protect consumer health. And the authority is therefore eagerly working towards the timely development and implementation of the HD for HDL component. Then the industry must also take steps to ensure that their products do not negatively impact the health of consumers who patronize their products. Thank you.
Can we give another round of applause to our brother? Thank you so much. I'm sure when we get to the panel discussion segment, you have a lot to say, because I'm eagerly waiting to hear how you respond to some of the questions that were asked and what Guta also has to say. We want to go on to the next set of presentations, but before that, we want to acknowledge Nana Bafo Jem Dakwa, who is the Senior Assistant Registrar for the Public Affairs Directorate. If you see all the cameras that you see around here, he's coordinating that. And we also want to acknowledge Madam Senam Klomegan, who is the former GAND Acting Secretary. Can you give us a wave? Can we please put our hands together for her? Very, very forceful. So can we set the next speakers online to make sure that they are on standby? We are moving on. We want to find out what works globally, what's happening internationally. We are trying to formulate a policy for Ghana. We need to learn from best practices. So we have very seasoned speakers from the world to speak to us, and they'll be coming on Zoom. We have the Senior Advisor Advocacy Fund, who is a Senior Advisor at the Global Health Advocacy Incubator, GHAI, specializing in front of pack labeling, marketing restrictions, and food policy advocacy. She has a PhD in medical and nutritional anthropology, and she's played a key role in shaping global food policies, including contributions to the Codex Alimentarius and UN initiatives. Dr. Marisa Makari will be doing this presentation with the regional senior industry and advocacy advisor for the Global Health Advocacy Incubator. And he is the regional advisor and oversees food policy advocacy across Africa. His expertise spans policy development, capacity building, and public health campaigns. He's worked with WHO, ECOWAS, and the Nigerian Ministry of Health. His leadership has influenced regional food and health policies. Dr. Adiolu Adebi will do a twin presentation by Dr. Marisa Makari and Dr. Adiolu Adebi. So Dr. Marisa will start and Dr. Adiolu will continue. Shall we put our hands together for them as they join us online via Zoom? Dr. Marisa, are you online? Can you please unmute your microphone and speak to us? We can't hear you yet. Hands on chin. Dr. Marisa. There's a problem with the PA system, so they'll rectify it for us. Give us a minute whilst we work on that. I see there are some mango chips at the back. Hey, those packaging are nice. Oh. There are mango chips, pineapple chips, coconut chips, some coated with honey, some, stylish things. It's being vended by a student of UHAS from the School of Public Health, I believe. And she produces them in Takoradi. Very nice packaging. I'm going to ask her if she has proper labeling on that product. Whether it's, do you have back of pack labeling? You do, Ankayento. Because, I mean, for a nutrition based institution, you should have that available. The public address system is being worked on very soon. I'm sure it's from here, so we'll work on it, Marisa. You can hear me loud and clear. Give me a wave if you can hear me, Dr. Marisa. You can hear. Okay, nice. Okay, so they'll work on it for us. HD4HL. What does it mean, Prof. Amuma? HD4HL.
Healthy diets for healthy lives.
Can we all please say it? The soprano is a lot in the thing that I'm hearing. I'm hearing a lot of soprano. I want the bass to come in. The men, are you here? HD4HL. Can we say it for the last time? HD4HL. Okay. And then we have what? What's the second acronym? Franklin, please approach the base over there so that you can help. Over here, yes. FOPWL. Charlie, acronym. So by the time you leave here today, these things should be on your fingertips. Anna, FOPWL, what does it mean? Front of pack. Is it front of pack or front of package? Front of pack. At the end of pack. Just a pack. How it is like. So front of pack warning labeling. Can I hear you? Very good. And now labels, mom. Label. Okay. And now FOPL. I know they say
Marisa. Yes.
Oh, Marisa is
yes.
on.
Okay, we can hear you now. We can hear you now. I think I'm providing the presentation.
Okay. So FOPWL is front of pack warning label, and FOPL is front of pack label. And then we have the last one, NPM. NPM is what?
Nutrient profiling model.
Nutrient profiling model. Can we all say it? Powerful. So, can we do it again? Another round of applause for Dr. Marisa Makari. Over to you. Africa.
Practice and lower the purchase of sodium, sugars, and saturated fats. Research has shown also very importantly that among children, these labels are the most effective in terms of influencing their purchasing decision. So we know there's a lot of evidence for showing how the warning label has been effective in reducing and discouraging the consumption of those unhealthy foods. 3, in terms of the third best practice, is there should be one FOP system implemented by a government rather than multiple. We see on the right side, again, an example of one FOP system. The Codex, as well as WHO, suggest the importance of having just one FOP system. And I'm saying FOP, but what I mean to refer to as front of pack label. Having a single system makes it easy for the consumer to identify, what the label is trying to tell them. There are other FOP or other practices in some countries that can confuse the consumer. Those are practices, for example, where maybe there's a warning label, but there's also an endorsement label to say certain products are unhealthy and other products are healthy. This can tend to confuse the consumer a bit. So the recommendation is to have really just one FOP system. And importantly, underneath these warning labels and front of pack labels is a very important key element, which are called nutrient profile models. So I know that's a mouthful, but basically it's just kind of, if you have a front of pack label, you have to know what products are going to get a label, or you have to know what products are going to get which label. And to identify that, you need to establish some thresholds to really understand, okay, this product is high in salt, or this product is high in saturated fat. So you need a nutrient profile model in order to identify those products, to establish those thresholds. And at GHAI, we've created a position paper, I'll share the link later, where we have, put together some best practices for nutrient profile models. And I don't have time to go into this now, but in general, you'll see that in this table, which is kind of the recommended nutrient profile model that we put forward based on some of the regional WHO models, has a few certain important elements. 1, it focuses only on those nutrients of sugar, so sugar, but also have health concerns. So we think it's important that those be identified on a front of pack warning label and within the nutrient profile model. And there's also, you'll notice for each nutrient, there's only 1, maximum 2 thresholds. There are some profile models that have, 17 different thresholds and 17 different categories, for example, for different foods. This is much simpler. It has just nutrients of concern and 1, maximum 2 thresholds for each nutrient. So importantly, you also see that we don't include in the nutrient profile model, and we don't recommend including in the front of pack positive nutrients. Like I say, those are the vitamins, minerals, and fiber. Why? Because the industry can take advantage of front of pack systems that incorporate those positive nutrients. They can kind of play around and reformulate, add micronutrients to make a product look healthier than it is. Also, some of those front of pack that combine nutrients, they don't allow the consumer to understand, is this product, green or positive because it's it's high in fiber or because it's low in sugar. It doesn't give a lot of information to the consumer about those individual nutrients of concern, really what's in that product. And also, the FOP has a certain objective that it does really well, in identifying and reducing the consumption of those harmful products and products high in nutrients of concern. But when you try to add lots of other objectives into the FOP objective, it gets diluted and it might not really end up doing much of anything. So it's important for the front of pack to really help to identify those negative nutrients, identify those products that could help to or could be harmful for obesity and NCDs. But if we start adding positive nutrients into a FOP, and other objectives like reducing micronutrient deficiencies or things like that, we could divert the objective of that policy, and as a result confuse the consumer and decrease the effectiveness of the FOP. So what we suggest is, if you keep the FOP policy with the objective of reducing the consumption of those harmful products, you can implement other policies alongside FOP in order, like school food policies and public procurement policies that can help to achieve related objectives such as addressing micronutrient deficiencies and undernutrition. But keep that FOP really with that one targeted objective of reducing the consumption of those most harmful products. And lastly, because I know I'm just over 10 minutes, is sometimes people ask, do we need a front of pack, or is nutrition education enough in order to solve the problem and to, help curb NCDs? And what we say is the front of pack label and all policies cannot be replaced by nutrition education or information campaigns. Although they are really important to accompany policy implementation, they're not enough and they're not substitutes for front of pack labeling and nutrition policies. Front of pack labeling is more cost effective, more sustainable than a media campaign or nutrition education campaign that would have to go on and really knock on the door of every school and every child and adult in order to kind of have the same effect as a front of pack labeling policy. And it's important to say that NCDs and obesity are not individual problems, they're environmental problems. They're environmental problems or environmental conditions that impact that individual level decision. So if we really want to impact that individual level decision and make consumer practices more healthy, we need to affect the environment, and we need to have a policy that works at the environmental level, at the population level. And that's why, the front of pack label, you just can't substitute it for nutrition campaigns. They can be alongside it, but they're not a substitute. So I just wanted to end on that, and then I will pass it over to my colleague, Ade, who will talk more about industry interference in the process of developing front of pack label.
Yeah, thank you so much, Marisa, and good morning, everyone. And I just, as a build up to to Marisa's presentation. Okay, sorry, I'm hearing. Okay, so as a build up to Marisa's presentation, I'm going to be making a presentation on understanding industry interference in the development of front of pack legal. It's important to emphasize industry interference because, as good as every presenter has mentioned, the need for proper labeling and for consumers' right and for consumers to understand what they are eating, we also need to understand that the industry also, who are the manufacturers of this food and beverages and other items that we consume, oftentimes are driven by profit, and because of that, they try to utilize products or processes where the overhead cost is kind of minimal and profit is maximized. Now, the essence of understanding industry interference is not about industry takedown, but in order for us to know that oftentimes industry try to play a huge role in governing the type of policy, food policies that we develop, not out of interest or out of trying to protect the interest of the population in terms of their health, but in order to protect their own interest. Now, looking at this slide, you see like the iceberg picture where you see at the tip a number of things done by the industry, which is around corporate social responsibility, in terms of lobbying, the revolving doors and legal threats, actions that are taken in the open to stop certain policies from being developed or being implemented. But beneath the tip of the iceberg is the industry trying to protect their reputation and brands and influencing regulators, which I also want to emphasize is the some in terms of when you're talking about developing front of pack warning labels, you hear the industry talk about we can do this ourselves, we don't need other policy to be developed, seeking self-regulation or self-governance in this process. Or you hear about why don't we just do nutrition education? Why nutrition education is very important, we also need to understand that we need a healthy environment, and this is where the laws and the policies help to regulate the healthy environment. For example, if we tell people you need to eat healthy and every available food that they can choose from are actually not healthy food, then the best they can eat is still from the food items that are not healthy. So if you are able to regulate the food environment and to ensure that there's a compliance and accountability by the industry on the types of products, what is being produced and what is being put in the market, and also they are regulated, and also people are well aware in a simple term, and that is what the front of pack warning label does, to help them to understand what the labeling information, and they can make a judgment to say, look, this particular product has this nutrient of concerns which I don't want to consume. And that is one thing that is that has shown that has been effective. But from the industry perspective, they want to defend freedom of choice, to say, oh, allow people to choose whatever they want. They also stigmatize civil society organizations to say, oh, probably they don't really know what they're saying. And oftentimes the industry also uses the trending issues, like we talk about human rights, food system, governance, and environmental agenda, to show that they are current and also complying with a number of these issues that you also care about. So we need to be conscious of this. And the messages from the industry oftentimes is to undermine policies, economic and low income household. They use their corporate messages to evade, to deny evidence. We've seen a couple of presentations speaking to the evidence of the front of pack warning labels, but oftentimes the industry positioning won't be like, oh, you don't need to, they may not say you don't have to adopt a policy on front of pack, but we give you reasons why you need to go for the least effective policies where the evidence is not as strong as expected. So at the end of the day, the industry get to have their way, and the problem in terms of nutrition health, it persists within the population. So industry narratives are usually used to undermine and weaken food policies. So we need to be conscious of this as we develop the policies in Ghana. There will be recommendations also from the industry representatives. They are, like I said, the essence of this is not about the industry takedown, but in order to make the industry accountable. And we need to be conscious of representatives who try to undermine and weaken the food policies, suggesting symbols or processes or procedures that have not shown to be strong based on available evidence out there. They also try to normalize the consumption of their product and corporate practices. One thing we are consistently seeing is the industry trying to promote corporate diet where most of the food are ultra processed just for people to consume them. They have more shelf life. They are easier to produce. They are faster to cook. They make them palatable. But how healthy are some of these products? These are the key questions that we need to ask ourselves. And oftentimes they hide the damages they cause because the effort of the industry in their production also damage the environment. Beyond people's health, the environment also get damaged in a number of ways. So a quick thing, how we want to reference in this presentation for us to be aware of industry positioning is a concept that we refer to as the positive nutrition, which is around corporate messaging and narratives to define and position corporate diet. This is being done consistently by the industry where it's been done in many clients, but it's growing within the African setting also at the moment, where issues around underweight, malnutrition are being emphasized. And because of that, the industry is coming up with concept around positive nutrition where they propose that, for example, a product that is ultra processed can be fortified with micronutrients in order to deliver that micronutrient to the people. This is more of an industry positioning and a way to sustain in a corporate diet, and is a way to also keep the sales up on ultra processed food. For example, there's a movement around fortification of bouillon cubes, which we all know how the level of salt in bouillon cubes, and how even as dietitians have always recommended the need to reduce the consumption. But now we are consistently hearing about fortification of bouillon cube to deliver micronutrient to people. So these are kind of practical example of positive nutrition. Or you hear people taking some ultra processed noodles and then fortifying it with some micronutrient, and they say, oh, this food is rich in micronutrient. And in other words, encouraging the consumption of ultra processed food. These are kind of industry strategy in an era where we are trying to encourage people to eat less of ultra processed food, but rather and focus more on less processed or minimally processed, food items. So this is one of the ways that the industry tries to interfere with development of effective and efficient policies at the country level. Sometimes they may try to stop this policy, but when they are unable to stop development of this policy, they try to weaken and make countries to go for the least effective policy or regulation where it is very easy to maneuver. And one of the things is also around the positive nutrition. So these are, because of time, I may not be able to go more into this slide, but these are the kind of, the industry playbook behind positive nutrition is all about positioning positive nutrition to deny the responsibility of UPPs. They try to make people think that with positive nutrition, the industry can create a standard for protecting, self-regulation, and to say, oh, we are accountable. We are also concerned about the people. And lastly, in responding to industry effort, we always encourage the government, civil society organization to be proactive, to understand first this kind of sensitization, to know that while in the process of development of policies and regulation, there might be maybe consultation at some point with the industry. We need to first always understand the industry positioning and the need to ensure that the highest level of evidence is utilized at every point in time, and not create a loopholes where the industry will be able to weaken our policies. I'm going to stop here and be happy to take any question further. So thank you, everyone.
Okay, thank you very much. So please, let's clap for them again. I'm sure they can hear. Okay, so thank you very much, Dr. Marisa and also Dr. Adiolo. So we would have questions for you, but if you don't mind, we would want to take the next presentation, then we'll come to you, if it works fine. So in the next 15 minutes, we are going to hear a topic on policy pathways to the formulation of FOPLs and NPM. To do this, we have Dr. Lauren Boateng. Dr. Lauren Boateng is a key member of the Ghana's Front of Packaging Label technical working group. She has contributed some scientific and policy framework for food labeling in Ghana. Her research focuses on food policies and nutrition education, and she's also a mentor to many people here. So at this point, she's also joining us online, and once she's done, we can ask a few questions, then we can move on. Dr. Boateng, can you please hear us?
Yeah.
Great.
Hello, good afternoon. And it's not so easy to hear you, but I'm hoping that you can hear me. Can you hear me?
Yes, we can. Loud and clear.
All right. So I will quickly share my slides and then we will take it from there. All right, please, can you see my slides? I cannot hear you, but can you see my slides? I'm showing my slides now. Can you see, please?
Yes, you can.
All right. So I will be speaking about the policy pathways to the formulation of the FOPLs in Ghana. And we'll quickly look at what are the initial steps that were taken, then the policy content and structure. Sorry. Can I go ahead?
Yes, please. Yes, we
All
can
right.
hear you.
The policy content and structure. All right, I'm sorry, but I can't hear. So I tend to hear a bit of talking in the background, but it's not so clear.
Okay, Dr. Boateng, we can hear you.
Yeah.
So I think someone can type in the chat box.
I can go ahead. All right. So we look at the stakeholder engagement and actors, and then we will look through monitoring and evaluation and how the communication of the policy and dissemination is being done. So these are the initial steps. First of all, to consider a policy of that nature, the National Development Planning Commission has a structured guideline for the development of public policy. And for that matter, there had to be an assembling of a team. So led by the Ministry of Health and the Ministry of Health and Food and Drugs Authority, then the NDPC as well, in collaboration with the University of Ghana School of Public Health. A team of relevant stakeholders, that is from the ministries, from the lawmakers, academics, civil society actors, a team of people, both local and international, were assembled to tackle the task. The first step involved brainstorming to formulate the rationale, which I'm sure a lot has been spoken about already. Then look at the global and the regional perspectives, as well as even the local context. What are some of the, for instance, you consider what are some of the existing policies and frameworks where, all right, from where we can take off? And then what are the best practices? We've just had the presentation from Marisa and her team about what the best practices are. Now, after this brainstorming session, then we arrived at, or the team arrived at a methodology that based on the structured process for developing a public policy by the NDPC. And then an initial draft was put together. Then there is another team of which I'm a part that's also looking at the initial drafts, the drafting, and then the initial draft, and engaging various stakeholders on what the meaning of the draft is. So looking at the policy itself, there's a vision statement, there's a mission statement, then there's a goal. The vision statement centers around empowering healthier food choices through clear and comprehensive front of pack labeling. Then the mission is to promote health by providing consumers with a simplified at a glance nutrition information that helps to make informed, healthier choices quickly and easily. Then regarding the goal, look at the underlined action words: to educate, to inform, to detect, to protect, and to guide consumers to make healthier choices and to reduce the burden of diet-related diseases to the barest minimum. So these are the vision, mission, and goal that underpin the policy. And this also to say that regarding the scope of the policy, the team agreed to use the mandatory policy. Like explained by Marisa earlier, it's found by research to be much more effective than leaving it as a voluntary kind of thing where every country can decide whether they want to make the front of pack labeling mandatory or voluntary. So Ghana has chosen the mandatory route. Then what is in the policy itself? So just look at the structure briefly, the background information of the policy, like explain situational analysis, the different perspectives and so on. Then the legal and legislative framework, constitutional provisions. Then chapter 3 looks at the policy framework, the objectives and the guiding principles. Chapter 4 of the policy looks at the strategic implementation of the policy objectives. Then chapter 5 looks at the action plan, the roles and responsibilities of the various stakeholders who came together to put the policy together. Then the chapter 6 is looking at monitoring and evaluating, or the monitoring and evaluation framework, the accountability measures. Then chapter 7 looks at the communication strategy for implementation and enforcement. So these, in summary, is the structure of how the policy looks like, or the different aspects that the policy tackles. Let's look at the stakeholders and their responsibilities. So this is being led by Ministry of Health and then the FDA in collaboration with the National Development Planning Committee and the University of Ghana, all under the HD4HL project. The multi-stakeholder technical task team, which is the M3T team, consists of actors drawn or stakeholders drawn from many different ministries: the Ministry of Health, Ministry of Education, Ministry of Finance, Ministry of Information, all, just to mention a few of them. But they had to come in, everybody, because different ministries have different roles to play within the context of the front of pack labeling. So therefore, in drafting the policy, they come in with a different technical perspectives so that nothing is left to chance. Then there are consultations also with the consumer associations, the industry, the civil society organizations, etc., all help to shape the policy better. And I guess this interaction happening today is actually one of such engagements, just to help to get the different perspectives and the different stakeholders making their input at this time of the process, because the policy itself is not finished yet, but we need to get these stakeholder engagements ongoing in order to be able to refine, improve it. Now, the policy has 4 strategic objectives. I've summarized them here. For each of these strategic objectives, there's also a set of strategic actions that will lead to the achievement of those objectives. Those are not here, but just the objectives to let us see. So the first objective is to provide a clear, understandable, and accessible nutrition information. The second objective is to prevent misleading claims and encourage industry to reformulate their products to sort of become healthier. Then to reduce diet-related NCDs through promotion of healthy eating. And the fourth objective is to align our practices with international standards. We live in a global community now. There are about 36 countries with FOPL policies, and Ghana is striving to be one of those countries that has an FOPL policy. What does the implementation plan and institutional framework look like? The Ministry of Health is the lead agency. FDA is responsible for enforcement, and then the collaboration with the different ministries, like I mentioned, agriculture, education, finance, local government. Then we have the public-private partnerships for the sustainability of the policy. How will the policy be monitored? How will we evaluate? What are the key performance indicators to look out for? Now, within the NDPC structured guideline for formulation of public policy is embedded a monitoring and evaluation guideline or framework. So that same framework has also been used to identify key performance indicators and to frame a monitoring and evaluation framework. So we have some of the key performance indicators as consumer awareness and understanding. How much the consumers know of the policy and the understanding of it is a key indicator. Then how much industry is complying and the presence of the policy initiating or triggering reformulation of products. That also is a performance indicator. Then what's the impact on consumption patterns? Are people choosing more healthier foods because now they are aware of what is in the foods because of the FOPL policy? That is also a key performance indicator. Then we look at the regular reviews and updates to the policy. As the policy is rolled out, eventually you begin to see that there are areas that have to be strengthened, areas that have to be addressed, things like that. That also will be a key performance indicator. Now, coming to the communication and policy dissemination, there will be a national launch and stakeholder engagement. So the stakeholder engagements, this is just the beginning of it. There will be several others. There'll be public education campaigns at different levels. There'll be media partnerships for awareness. Once you roll out a policy like that, without the media to give the awareness and the publicity to it, it's not likely to reach or penetrate very much in the population. Then we look at integrating it into school curricula at all the different levels of the educational ladder, so that by the time a child is finishing one stage of school, they know that there's something called the FOPL, another stage, right up to higher education. So in summary, the FOPL policy is crucial for public health. The multi-sectoral approach we are using in Ghana is going to help for a successful implementation, and then going to empower consumers for healthier choices. And also we're looking at strong monitoring and enforcement of the policy for sustainability. Thank you very much. And over. Thank you.
Thank you very much, Dr. Boateng,
for the opportunity to present.
Please let's clap for her. It has been very, very, very insightful. And I'm sure some of us have questions for our speakers. At this point, because of time, and they're also still waiting, so we have Dr. Marisa, Dr. Adiolo, and also Dr. Boateng online. Do we have questions for them? Questions? Questions? Okay, great. Come again. Yes, so we'll have a panel discussion shortly, and during a panel discussion, some of these things would come up again, and they can address some of the questions that came up. Okay. Any question? Hey, none at all. Okay, so at this juncture, I would want to say a big online, yes. Our online audience, do we have questions from you? None. Okay. That's interesting. Oh, we are hungry. Okay, we'll be getting lunch soon. Let's hold on. So at this point, I would want to invite Nana Kofi to introduce the next.
We'll be having a presentation by Prof. La on the state of Ghana's FOPL and NPM policies. So that will come up shortly. But I don't want to believe that there are no questions. I believe there are. Maybe you are not gingered enough to ask them. But I'm sure, I've been wondering, did you hear the research that there's a question here? Okay. Did you hear the research that Dr. Marisa mentioned about the fact that the dark, what's the name? The black ones, the black and white ones, were the most preferred warning labels that as seen from research. It was very interesting. So I'm wondering whether we cannot have a survey here or a research of some sort to find out which ones our people would prefer, whether the color-coded one or the black and white one. You know, do you know black and white toffee? Alewa. Whether the Alewa one or the colorless one. Boss, you ask your question. Okay. The FDA, you are asking FDA. Hey, FDA! FDA who has somebody proper. Okay. So, FDA, I hear a lot of the questions are for you. But Della, if we can get Prof. La on, do we have Prof. La online?
Prof. La?
To continue. Della, if we can get Prof. La, it's not on yet. Okay. Prof. Amuma will make a statement.
Thank you very much. Whilst we are waiting to get Prof. La, I was just wondering, in relation to the presentations that were made by the Guy team, particularly the role of industry and the way that they try to go around the issues, I'm just wondering, I know that there are strategies to combat that, but yes, this is a constant thing. For somebody to tell me that nutrition education or front of pack labeling has been going on for many years, but people are still having NCDs. It's just not on. So how do we in developing countries, such as Ghana, where we are import-led, we tend to import a lot of products, how do we address those issues? And how do the advocacy groups help us? Thank you.
So that's for Dr. Diolu or Marisa. Either can answer. So if Marisa or Dr. Diolu is online, please answer the question for us. We are asking on what strategies we can use to mitigate industries' possible. Yes. Yes. So positive nutrition issues and all those things. It's interesting. Now Maggie Cube is fortified. You have another question?
Good afternoon. I'm George, once again. This is my concern. We are talking about the policy and then the environment. All of us here, if we should just go to the junction there and we want to get a healthy, maybe snack, all that you will see there is this unhealthy snack, the drinks and then the rest. So if you are emphasizing on the policy, the environment, the education, and the people are aware that this and this is not good for my health, and the availability of the healthy snacks or the healthy food are not with us, so what are we going to do? And there is this perception that eating healthy is expensive. And sometimes I tell people that that is not true. Because now malt is around 15 cedis and maybe snack is around 10 cedis. That is roughly 25 cedis. But banana, how much is banana? And then let's say the snack we took. If you put all together, it will be far, far less than what you would have acquired with the 25 cedis. So now that we are all trying to eat healthy and those particular foods are not available, what are we going to do to solve that issue? Thank you.
Okay, very good. Gobe is how much right now? It's how much? 20 cedis. Gobe 5 cedis. No 5 cedis anymore. How much? 10 cedis. Is it the beans and the oil and the gari which is 10 cedis? Now I hear people are selling the oil too. Extra oil. How about the pepper? they sell pepper. And then tatale how much? Tatale.
Yeah,
So I told you need like 3 tatale. And then people buy fish in addition. So you're saying that that one is more expensive than the sugar sweetened beverage and some spring roll. Eh? Okay. Is Dr. Diolu on? If Dr. Diolu is on, he can unmute and respond to the question for us.
Yes, can you hear me?
But maybe Dr. Lorraine, is Dr. Lorraine also on? If Dr. Lorraine is on, she can respond to the question about the cost of healthy eating. Dr. Boateng, please unmute and respond. Dr. Diolu, if you're also on, any one of you can unmute and respond to the question. There's a question on positive nutrition claims from food industry and how we will mitigate that. There's a question also on healthy eating being expensive and how we are factoring that into the advocacy that we are pursuing.
Need to start from. Then in terms of the process, oftentimes the industry always seek co-governance of the food system or the food policies space. While the industry has a role to play, they have a role to play as well. I will say that the experts are the ones that should be mandated to draft these policies and not the industry. At the level of finalization and consultation, yes, there should be a place where that may happen, but in terms of development and the drafting of the key content of the policies and the presentation, this should be left to the experts to do and not with the industry representation. Then the last thing I will mention is about consistent monitoring of the process. Consistent monitoring of the process will also help to have a full proof of the entire policy and implementation to avoid the loopholes that industry often exploit. Like I said in my presentation, many times they may not even directly oppose the policy, but they try to target and ensure that you go for your provisions are very weak. So that by the time the provisions are weak, they can really maneuver and go around it. And I think that was also in one of the example of the presentation from Marisa around even the positive labeling that, in that, for example, in Israel, where consumers there was an intention to encourage consumers to consume products with positive logo, and industry also came up with positive logo to show environmental friendliness. So when people go into the supermarket, once they see the positive logo, they just feel like, oh, this is, has more nutrient, and then they go with it. So these are some of the things we need to be careful to ensure that our policies are like watertight to avoid industry manipulation and exploitation. So it begins with going for the highest possible evidence that is out there, ensuring that the experts are the ones drafting the policies and not the industry, and then effective monitoring of the implementation. Thank you.
Thank you very much. And also to Dr. Marisa, we thank you. At this point, we'll just come back home here. We have someone waiting to give us an interesting presentation. He has been at the forefront of this issue for a long time, and he is the right person to give us the last presentation for today. His name is Professor Amos La. Prof. La will be taking us through the state of Ghana's FOPL and NPM policies, what citizens should expect from the HD for HL project outputs. He's a leading public health nutritionist at the University of Ghana, focusing on food systems, nutrition-related diseases, and public policy ethics. As the principal investigator of HD for HL project, he spearheads efforts to develop a nutrient profiling model for Ghana. Recognized globally, he has shaped food-related policies and contributed to major UN and global health initiatives. At this point, I think you all agree with me. He is the best person to do the last presentation today. So, Prof. La, Prof, can you please hear us?
Thank you.
Great.
Good afternoon to you all. I hope it is afternoon.
Yes, please.
Wherever everyone is.
Yeah.
I heard Adiolo speak. I don't know if there are others from the global north. So if it is morning to you, good morning.
Good morning.
Also. So I'm not sure, I don't know how much time I have, but I was asked
Please,
to provide
20 minutes.
Updates on the HD for HL project that is supporting government to develop a bundle of food-based policies. And so that is what I aim to do in this presentation. As far as today's presentation is concerned, I do not have any conflict of interest, particularly financial conflict of interest to declare, but I wish to disclose to listeners that I'm a principal investigator of a number of food environment projects. I also serve on advisory board of a number of initiatives, but all these are dedicated to promoting public health. So I believe my involvement in all such represents a confluence of interest, not necessarily a conflict of interest, particularly based on the views that I'm going to be expressing today in this presentation. Why are we supporting government? Or supporting government to develop this bundle of policies? Or why is the Ghanaian government interested in developing a bundle of food-based policies? That is essentially motivated by our understanding of the Ghanaian public health nutrition landscape. The country for several decades has been battling with food insecurity, but also undernutrition. Micronutrient malnutrition, including anemia, both in women and children, remains a big issue. And whilst that is not, dealt with sustainably, we are also currently battling with overweight and obesity, particularly among Ghanaian women. So that which you see, that looks like a jet taking off, is the trajectory of prevalence of overweight and obesity among Ghanaian women. This is data we have generated locally over years using the demographic and health survey. And so, the DHS work in Ghana started in 1985. In 1993, when data on weight, height were made available, prevalence of overweight and obesity was computed among this group of Ghanaians, and it was 10%. If you look at the trajectory, it skyrocketed to about 40% in 2014. And around that time, some of us were projecting that maybe by 2020, we should be hitting, as you can see, 50 or so. And truly in 2022, when the demographic and health survey was done, you would see it published in 2024, but the survey was done in 2022. We had 1 in 2 Ghanaian women being overweight or obese. The other problematic observation that one can see from local data is the early socialization of Ghanaian children, including infants, to unhealthy food. As you can see here, 31% of Ghanaian children aged 6 months to 23 months were given sweet beverages a day before the demographic and health survey was done among these participants. when the scope of unhealthiness of food was expanded beyond sweet beverages to cover sentinel and healthy food, you can see the rate inched up to 33%. And so this is an issue in Ghana, but indeed, it's not just a Ghanaian issue. Professor Popkin and I recently, following the talk I gave in 2022 to the Ghana Academy of Arts and Sciences, worked on this paper where we looked at nutrition transition, especially in relation to this particular matter. And so nutrition transition's latest stage is this widespread availability, including economic accessibility of ultra-processed food. And we have argued in this paper that it is harming preschoolers' diet and dooming their future. And so for those of us who advocate for interventions to respond to this, we recognize the interconnectedness of the determinants of health. For us to be able to protect, to promote, and viralize healthy food, a mono intervention or a single, uni interventions approach wouldn't work. We need multiplicity of related interventions that complement each other. So we have to recognize the determinants of health, that theory of connectedness of the determinants of health. So ecological determinants of health, social determinants of health, but also lately we invoke the law as a tool to promote public health, legal determinants of health, but also commercial determinants of health. Some of the actions or inactions of actors with commercial vested interest in this space, as Adilo was responding to a question, can be used to stop, to delay, or frustrate. Even if you are successful at coming out with a policy, they can frustrate implementation, but obviously also dictate determinants of health. And you would see in some of the policies we are working on, we've taken cognizance of that, and some of the policy provisions include, sanitizing or improving food environment also at the dictal level. As Barry noted, the world is experiencing a nutrition transition, but that transition is just, headed in the wrong directions, where foods such as this that we should be enjoying and benefiting from, and foods including these that we should be enjoying and benefiting from, are no longer the usual. What you see is what you see here, and these are adverts, but they are not only just adverts, they are adverts of food that a lot of us are indulging in. And it's as a result of that Indomie can present itself to be the king of all food. Because we are transitioning, because we have transitioned, that got to be, the course got to be, corrected. There has to be a course correction intervention. So the policies that are being developed by the Ghanaian government are efforts to course correct these. The third problematic observation has to do with the availability, but also economic accessibility of sugar-sweetened beverages. We have argued for some time now that if we don't have interventions to address this, sugar-sweetened beverages will become the next tobacco. I've already talked about the need for us to leverage the interconnectedness of determinants of health, social, legal, and commercial. And so for us as public health professionals, as advocates, as researchers, whatever each one of us can contribute in any small way to making food environment health promoting and disease preventing, we should. One of the ways, as I've talked about earlier, is invoking the law. So through regulations. And when I'm talking about regulations here, those of you who may not have engaged the literature in the regulation space, especially as far as these policies are concerned, you may for the first time see self-regulation and you would think, oh, okay, it's also one of the options. Of course, it's an option, but it's not a good option. There's almost overabundance of scholarship that show that self-regulations do not work. And politicians have known that for years, right? U.S. politicians once said that if men were angels, no government would be necessary. And because we are not governed by angels, we need internal but also external controls on our government. That applies to the space that we are in. We need controls. So it is only angels who can self-govern and do so effectively. If an entity, an actor in this space is advocating for self-regulation, you should know they are doing that just to entrench the status quo that they are benefiting from. As a result of that, we do have a number of actors in this space, local and global, who have been advocating for the use of both policies, but also creating the enabling environment for food environment to be improved. So those who may not be very familiar with these food environment policies, what you see here, the top policies, they are all food environment policies. You can have food composition policy that would dictate what should be included in a product that is deemed to be food: labeling, promotion or marketing, food provisioning, food retail, food prices, including fiscal policies. We talk about sugar sweetened beverage tax intervention. They are part of the food price policies. And then you can see down the enabling environment or infrastructure support interventions. Once all these are deployed and are deployed effectively, we expect that they would contribute to improving our food environment. But which setting and which policy? We know the policies are effective in making unhealthy food, for example, unattractive and unavailable. But which policies and where? Every setting needs to diagnose and understand their setting, and therefore that would inform the kinds of policies that they need. We have argued that the peculiar heterogeneity of various national food environment, and therefore if you take the African food, we can't even propose a single policy for all countries to use unless you have done your diagnosis and then assessment. And so settings need to diagnose and understand these heterogeneities, but also the variegated political economies. You have something that works for Nigeria, but it may not work for Ghana because of the differences in the political economy. We have noted, as I started, with the public health nutrition landscape, Ghana is facing a syndemic of undernutrition, overweight, obesity, but also diet-related non-communicable diseases. So as a country, we are desirous, we are interested in getting policies that would disincentivize consumption of unhealthy food. And those are impactful, but we also need policies that would avail healthy food or nutrient-rich food. So I would move to how this is being applied then in Ghana. That is through the Healthier Diet for Healthy Life project. This is a policy development project. Those who understand how policies are developed in Ghana and therefore any other country. Academics do not develop policies. Policies are developed by government agencies with a mandate to do so. So as academics, we are just facilitating and supporting the government actors. You can see here, some of them have their logos here. This needs to be updated. Ministry of Health, the National Development Planning Commission, Food and Drugs Authority, Ministry of Finance is part of it. They are co-leading one of the policies, and Ministry of Food and Agriculture. We have University of Ghana here coordinating and providing the technical backstopping. We are working with all other academics in Ghana with expertise in this, and a coalition of civil society organizations, CAPA, whose members include, I think GAN is part of those who are organizing this. So GAN contributes to the that civil society coalition. The HD for HL philosophy has been that a government, and therefore Ghanaian government, can implement a comprehensive set of policies. These we usually would refer to them as both low agency policy and high agency policy interventions. The policies as a bundle, some would seek to inform and empower. There are others that would guide and influence. There are even some of the other policies that would discourage or restrict. and the availability and therefore consumption of unhealthy food. Once that is done, we believe, or we have argued, that food environment actors would either make immediate decisions or actions or strategic actions, eventually reducing availability of unhealthy food, their accessibility, and also consumption. So, but what I just said is what is presented here diagrammatically, but we understood that for this to work effectively, you need to have a science-based approach to determining that this particular food should attract this policy response. So that led to the development of the Ghana nutrient profiling system, and is applied to the 4 policies I'll be talking about soon. I've already speaking ahead of my slides. So this is the coordination framework for the HD4HL project, supporting, you see, University of Ghana helping, coordinating, and supporting the government actors. I would skip this a number of slides providing context. We are aware of the vestedness of the interest in this and the actors who sometimes contribute to, either policy implementation, but also development. So we put measures in place to ensure that corporate political activity do not negatively impact the process. There's a publication coming out soon in Health Promotion International that illustrates the awareness creation, but also conflict of interest and CPA literacy improvement intervention that we implemented as part of the HD4HL project. We also conducted a number of policy analysis, including policy coherence analysis, as well as reviews. Some of the reviews were done as part of the Advocating for Health work that the Guy team and Bloomberg Philanthropy supported. There are other reviews that were initiated by the HD4HL. All these are going to be published in the forthcoming special issue that one of the top journals in our space, public health nutrition space, has accepted to publish. So we are working on developing the manuscript soon, and then will be submitted to that special issue. I would like to skip a number of these slides. This is the work package 2 of the HD4HL project that aimed to develop the nutrient profiling system. So we went through a very rigorous process of, you can't have a nutrient profiling system without local data or food composition data, or maybe you can have, but it's not going to be fit for local purpose. So we went through that process of generating that data. This took over 2 years to get the data. So in the end, we got close to 12,000 food products. Some of them did not have the requisite nutrition information. We ended up using about 6,400 processed food with nutrition information that we use to generate the Ghana nutrient profiling system. And so this system has been developed. We are currently implementing a series of validity testing. We have to validate what the nutrient profiling is saying. If the nutrient profiling says Tampico is healthy, we want Lorraine, a dietitian here, or we want Asi Kasim and others, as is ahead of Perko and Co talk. We want Prof. Amuna, or the expert in Ghana here, nutritionists, dietitians, to independently also, rank Tampico as healthy or not. If nutrient profiling says Tampico is healthy and the experts are saying it's not healthy, there's a problem. So we are going to go through that process. So we'll do phase validity, we'll do content validity, and then conversion validity. Construct validity was integral to the development of the process. So that has been done already. So now we have developed a nutrient profiling system. As soon as the validity testing is complete, it will be launched. But that did not prevent Ghana from going ahead with the development of the policies. Mind you, those who may not be familiar with the process, we started with an idea of coming out with regulations, legislation, or law. But during the process, we were made to understand that there were important legal changes in the policy development space in Ghana. And so for regulations to be developed as we were proceeding, there needed to be a policy which would serve as home to the regulation. And so, for example, those who, and some of you may benefit from this, we have had since 2012 Public Health Act, which is the law that we used to back some of the advocacy interventions, but also, food environment improvement interventions in Ghana. Ghana as a country felt there was a need for that law to be updated. Yes, the Ministry of Health started the process. And that's when the attention was called to the fact that even at the time that that law was being produced, because it was permissible then, there was no policy that would serve as a home to it. And so they had to take a step back and go ahead and develop the Ghana Public Health Policy. Once the policy is developed, then the amendment and the new law that will come, the Public Health Policy will serve as a home. So it's the same thing that is happening to this process. First, 4 policies would have to be developed. And once the policies have been developed, and they've been developed, hopefully they'll be out soon, then the process of developing the regulations or laws would start. So I just want to, I picked only one, the front of pack labeling aspect of the nutrient profiling system. This is, there are 4 policies, but one of the policies that stakeholders, not necessarily actors, stakeholders, and some of the stakeholders do have interest, have been, fighting, battling us, is the FOPL, and we all know why. So the nutrient profiling system is going to be used to be applied to 4 policies, but I'm just focusing on the front of pack labeling policy here. There are a number of you who are part of the policy development process, and you saw the pages that are circulated. Some of you provided input as to how the nutrient profiling system should apply in marketing, in labeling, in food provisioning, that's a public food procurement and service policy, but also fiscal policy. So for the front of pack labeling, we hope to use the nutrient profiling system to categorize Ghanaian foods. You are going to have food or food products or food or food product with 1 or more front of pack warning labels. Why? Because they exceed the thresholds that are set by the Ghana nutrient profiling system. And if you exceed a threshold for, say, salt or sugar, then you would have to bear a mark or a label that shows that that product has excess of, say, of salt. Then we are going to have, or we may have, category 2 food. So food or food product that do not have any warning label because they do not exceed any of the thresholds that have been set. And yet this food may not be the best. The fact that you haven't exceeded salt doesn't mean that food is healthier or healthiest. And then we will have then a subset of food that do not have warning label because they do not exceed and yet are deemed to be very healthy, and they would then be considered in the targeted subsidy intervention, but also the public food procurement and service policy. Okay, so warning labels, if you have excess sugar, you have to have, a product would have to have a warning label. If you have excess sodium, would have to have a warning label. Excess amount of unhealthy fat, you have to have a warning label. Trans fatty acid, for example, is unhealthy. Saturated fatty acid, there are debates, and it is okay to have those debates. That's how science grow. Some countries in the past have used total fat. As these debates, ensue, there are suggestions or recommendations. Doesn't mean countries should just take them, swallow them, line, hook, and sinker, but there are debate as to why total fat should be excluded. Excessive amount of, as I said, industry-produced trans fatty acid. WHO and others are working globally to eliminate. Elimination doesn't mean you have 0 trans fatty acids in the food. That's not what it means. Okay. So artificial sweetness. some of us contributed to WHO's development of the global guidelines on artificial sweetness and others. We felt it is also important for products that have artificial sweetness and to be labeled as such. In addition to the warning labels, we have a system to introduce positive logo as well. I heard Adiolo talk about the challenges in Israel about their positive logos. That is fine. We learn from other countries. People sometimes would have genuine public health promoting interventions, but then you can encounter challenges. As you encounter challenges, you learn from them. So for a product to be allowed to carry a positive logo, that product in the first place must not have a warning logo. So these are the criteria. So food may qualify for positive warning logo if they meet set criteria. So one, front of pack warning labels. So foods bearing or designated to bear front of pack warning labels would not be qualified to have a positive logo. For not processed or minimally processed foods, so fruit and vegetables, pulses, whole grains, not just whole grains. These days, we even have whole grains that are ultra processed. So there has to be a distinction between just whole grains and, whole grains that are ultra processed as healthier options. Environmental and packaging sustainability. Those who understand where the world is headed would understand that these are important. And so we want our food environment policies to recognize that as well. And so food, first of all, would have front of pack warning labels that show this attribute would need to be promoted as such. So the policies, we went through this process, the policies have been developed. The civil society have since the beginning been doing sensitization for the Ghanaian food environment actors to understand why we need these policies. I believe what we are doing today is part of that sensitization. So actors would understand why these policies are needed. I think I would stop here in the interest of time. So we do have the Excise Duty Amendment Act. We have food-based dietary guidelines. In October 2024, we got the trans fatty elimination strategy launched. Like I said, this nutrient profiling system has been developed to be launched soon and is being applied to these 4 policies. Yes, just one slide. I want to call your attention to something. I'm skipping this. We all contributed to this, and that's what led to the birth of the Excise Duty Amendment Act. Just last week, I saw a publication in the Ghanaian media from FABEC, Food and Beverage Association of Ghana, but also Ghana Industry, calling on government to scrap the Excise Duty Amendment Act. They refer to that as nuisance tax. And so some of us had to, provide a rejoinder or a rebuttal. So I published a lengthy op-ed on my blog. I also got it published on Joy. I got it published on Ghana Web and Metro TV. I think 5 or 6 other portals. I think this is something that all of us should be doing as we advocate for fit for local, public health policies. We should be ready at any point in time to also counter actors with vested interests who may either want to water things down or frustrate implementation. And in this case, they were calling for a repeal of the policy. All of us, I encourage all of you to join that fight in letting Ghana, including the government of the day, know that that policy should be here and it should stay. The fight for public health should not stop until all of us are healthy, and not just healthy today, but healthy forever. I would yield here. Thank you.
Thank you very much, Professor. Oh, a louder round of applause. Powerful. Professor La, you are so much of a blessing. Thank you so much for doing this and leading the charge for the work that will help our countrymen. We are a developing country, and we are on the road together. Now, we've got into low, middle income status. And some of these things are necessary for our advancement, especially in the light of the staggering statistic on NCDs that hit us in the face. I believe that the apologetics on excise tax must be done by all of us, the nutrition professionals here and the like, or people related to it must do that work for us. Thank you so much, Professor. I just have one question. Because I'm the MC, I have the prerogative to ask that question.
No problem.
And then, what was the question? I wrote it somewhere.
It will come. You get it. I'm here.
Are you reconsidering your position on the positive logos in the light of the evidence that has been adduced by Prof. Diolu, to the extent that the research doesn't support that? I mean, I had an interesting small discussion with my co-MC about whether, I mean, the case will be that the positive logos will be negative or positive. I think it's a debate that we can all think about. But I don't know what your position is on that, and whether you think that we should toe the line of the evidence.
Thank you. And it's good to have, such conversations. As I noted earlier, I'm a scientist. Science doesn't grow without frank conversation. Some of those conversations sometimes can be emotive, but that is important. We don't back away from proposals that we deem can benefit health because there's evidence that speaks to their weaknesses. What we do is we remedy those weaknesses and proceed. And once you remedy the weaknesses and proceed, that which you introduce would be evaluated. And who knows, that evaluation would show that the remedies that you put in place suffice. And that which you introduce then becomes the next intervention, right? So if countries, including Israel, have introduced a positive logo and there are weaknesses associated with it, you don't say you don't use positive logo. Find a way of addressing it because, as I said, all countries have their unique needs. If a particular country is not interested in a positive logo, it doesn't mean another country should not be. In any case, we are aware of that evidence. As I did in my presentation, you would see it is not every product that will be allowed to have a positive logo. Once you bear a warning label, you won't be allowed to have a positive logo. Those are not considerations that other countries have taken into account. So I don't think Ghana, it's not me, but I don't think Ghana is going to back away from that.
Okay, thank you very much, Prof.
No problem. Yeah. Well, we are recognize the weaknesses and then put measures in place to address those, weaknesses.
Okay. Thank you so much, Prof. You never growing old. I mean, the way you were. Please put your hands together for Prof one more time. Thank you. We'll permit you to go back to your duties, and we are going to the very interesting segment of today's activity. Thank you so much. This is where we'll have face-to-face. This is where it's going to get hot. It's going to get very hot over here. So we're paneling a team of experts who will speak to the various concerns. Guta is here. Guta. Our business. Guta says our business. Are you people coming to attack our business? Or what are you going to do? You people, why? Every time you are bringing up something, what is happening? We'll hear the Guta perspective. And the professionals will also speak on them. So I want to start inviting people to come and fill these 6 chairs. We'll hit them questions. They'll ask each other questions. They'll throw in their concerns. In the next 30 or so minutes, and we'll be done and we'll go. I hope you are learning something, especially the students and I hope you're writing something. Want to first invite on the GAN governing body, or the guy to represent GAN, RD Daniel Mensah, nicely laddered in a suit. I wonder if he has a preaching appointment tonight. We are celebrating African Month, eh? So, very good. He's my brother, so I can put him on the spot. So we'll invite Professor Paul Amuna, nicely dressed in his African outfit, Ghana Month. Yeah. And we have my brother from Israel and also from ANLP to come up here. He's written a lot on this area. He's an expert in this area from School of Public Health, from the Department of Community Health and Family Health. Dr. Geoffrey Asalu, louder one. These are your mentors. Can we have a rep from Saint Ghana, Baba, or Baba will come and take a seat. Oh, clap for her. You don't often find young ladies putting themselves up. Master Edem, or his Miss Edem Denitri Ameflu. So the FDA rep will come, okay, on his behalf, or on her behalf. The name is what? Bright. Hey, please mention your name so that they hear. I want the name to come out very well. Bryce Agli. Hey, Charlie. It's in Oyangwangwa. Anyangwangwa. And then we have Mr. Griffiths George Legbeje. I need to do my intonations very well. I'm thinking, so I must. Did I butcher your name? The Legbeje is not correct. How is it pronounced? It's Legbeje. Legbeje. Wogbejeke. All right. So I'm sure we are set, right? Okay, and me too, I'll sit here. You can help me, eh? Please, I'm not this thing, anything like that. So we have FDA. Okay, please throw them the questions for me. We have SEND. We have Gand. We have Professor from Public Health giving us, this guy is an international man, so we have, and then we have, you are a nutritionist, right? Okay, so I want to start with Guta. Is Guta is not here. Hey, how can you leave Guta out? Togbi, they're supposed to ask the questions. Okay, all right. So Togbi, I'll give you the mic first. Togbi, they have bombarded you. Everybody is talking. What sayest thou? What shall you say to these things? Togbi, say something. If you have any question, any concern about the policy.
Thank you. I think my question will go to FDA. I don't know how you will take it. Let me personalize it.
Feel free.
Today's program is a nice program, but personally, the end result will depend on FDA. I don't know how often you do visit shops, markets to monitor their products. I'm a graphic designer. You see a lot of people will come design this thing for me, and most of the information, they will copy it from internet without even knowing what they are copying. My question is, for the past hours we spent over here, at the end of it all, if FDA is not able to monitor or to educate the public, our sitting here will go in vain. How best can FDA do to protect what we started or what we are doing over here? Thank you.
But before then, I want to have your general impressions about the policy. Yes.
Thank you. I think it's a very good policy, and implementation is good, but continuation. Sometimes we always spend time like this to start something nice, but how to continue and monitor, that's the problem. But generally, it is good, and I'll urge the committee that they shouldn't be the end. They should pursue it. At the end, we'll get the end result. So it is okay. Thank you.
This one deserves a loud round of applause, though. Guta, yes, is supporting the policy. So we are almost home and dry. Anna, FDA, you have the floor to respond to.
Togbe, thank you for the question. Your concerns have been well noted. So yes, for the policy to take root, is definitely the onus lies on FDA to continue with the enforcement aspect of the policy. So like we said, this is a front of label packaging that we are working on. So for every label that comes to the authority for a registration of a product, we do something we call label evaluation. So for every label that you bring, we will look at what is on the label. It should correspond to what is inside your product. So if you've brought us a honey product and you've written something different on the label, we request for something we call certificate of analysis. So when you analyze your product, you bring us the certificate of analysis. We will compare whatever is inside that certificate of analysis to what you've written on the label. If there is a need for you to remove something from the product label, we will tell you. If there is a need for you to do an extra analysis for you to substantiate whatever you've written on that label, we will inform you. So we will make sure we reconcile both aspects before regulation takes place, before the approval is given. So like you said, yes, there's a possibility that people will come to Market Graphics and come and get their labels done. They pick information from the internet. But when you bring those labels to the authority for us to register your product, we will need to make sure that there is a reconciliation effort. And even when you bring the certificate of analysis, be it from Ghana Standards, be it from Food Research, we do our independent in-house analysis. So the FDA also has a lab that we also test the product to be sure that it matches whatever analysis you've brought to us before we reconcile both with the label before we do the registration. So yes, there is a possibility they could get information from the internet, but we do our due diligence. And moving ahead, with the aspect where we would continue with the enforcement, we do something we call post-market surveillance. I think the challenge comes with how most people are not privy to our modus operandi. So there's an activity we call post-market surveillance. I'm actually with the enforcement department. And with the enforcement department, our job is to make sure that anything that has been given to us during pre-approval is the same that is what we find on the market. So like you asked whether we move from shop to shops. Yes, it's part of our activities that we will move from shops to check the product. During festive periods, we also put those activities into a larger frame. So especially maybe during Christmas, where we realize that there will be an influx of food products on the market, the likelihood of people selling expired products, the likelihood of people reducing the prices of items to offset the quantum of goods that they have. We large scale up our activity where we visit these facilities frequently. Then we are able to determine that the products, one, the labels are okay, the date markings are okay, they are not expired, they are not scratched, they are not dented, they are not bloated before the festive period kickstarts. So yes, like you said, if the enforcement aspect of this activity is not really taken into critical consideration, yes, the policy might falter. I also feel when this policy becomes a legislative instrument, it becomes binding on the authority to make sure that everything is put right. So if it's law and you bring your product and it doesn't conform to what is supposed to be on the airline, we are not going to register your product. If we do that, then we are going against what is mandating us to also work. So yes, the enforcement aspect will be quickly looked at. Then there will be stakeholder engagement with this food processing facilities too. Definitely we do trainings for these facilities. So in some of these trainings, we are going to make them know about this policy that is coming up and the need for them to also reevaluate some of their labels and some of the nutritional profiles that have come up. In doing that also, we will make them understand that with FDA, when you want to renew the registration of your product, we request for your certificate of analysis again. In as much as you've registered the product, when you want to do a renewal, you have to retest the product to be sure that it's the same product that you are doing during the lifespan of the product. So we request for the certificate of analysis for the product label, and on that label requirement, we give you options to check whether you've done any additions or subtractions to the previous product that you submitted to the authority. And if there are any omissions or there are any additions, we'll reconcile and make sure that it's okay before you register your product. I hope this answers some
Thank you very much.
Of you.
Thank you. Thank you. Let me take a few comments before I come to you. Please, let's give the responses very brief and straight to the point so that we can get as many. I'm coming. I want to take a follow-up. Is there a plan for legislation on after this policy thing? Yes or no?
Yeah, the answer is yes. And you heard what Prof. La was saying. We actually have a set of 4 policies. It's a policy bundle. So the front of pack labeling is one of the 4. And the approach that we are using is that before the law comes, the legislation, there needs to be a policy. And then Parliament will debate and all those things. And then they will then come up with legislation, then becomes an act of Parliament, and then it is fixed. So that process will take place.
I want to hear from Gand. Gand and nutritionists. You know, the integration into practice, how it's going to impinge upon the practice, and what do you have to say about the policy, and any additions that you think that should be made straight to the point. Also.
So I guess that is the main reason why we partnered with Send Ghana and other partners to get this done, because at the end of the day, we translate the information on the packs to be able to help or warn our clients. And being in a society with a worsening obesogenic food environment and a rise in the non-communicable diseases that is actually scaring us. Somebody will say that you from where we stand, we can literally see the end of the public health trajectory of this country in the next 10 to 20 years, which is quite scary. It is in our benefit, or it is going to benefit our practice to be able to use this information to help our clients and prevent what we we don't want to see in the next 10 to 20 years.
Thank you so much. So please, you pass the mic so that I don't move about. And the nutritionist, yes, I think you have a bite at this one. Please pass the mic to him. Speak to the Volta contest. You understand? The Ademe, the Goma, and the Kuka, the Suaka, the Kuwewa Busheshe, and the Shure, and all those things.
Okay, thank you very much. As they are working on the policy may state a lot of healthy practices that may be on board that will help the community members to understand the food labeling and what is expected of them to consume. So when we get the policy, we will ensure that we have community health nurses in all the communities, we have volunteers. We will try and modify it in such a way that it becomes friendly, reader friendly, and the community members we have DBS, and we have child welfare clinic sessions. So we will make it a point to make sure that they incorporate it into their health promotion activities so that the population will become aware of the policy.
All right. Thank you very much. Please pass the mic to Dr. Salu. I've not heard from you. Talk to us. What are your impressions? What are your add-ons, takeaways, subtractions, and all that? The audience is also listening to you.
Okay. Coming from public health, and our focus is to maintain population health, and the fact that consumption of food that are high in sugar, salt, and fats are linked to obesity and non-communicable diseases. And recently, when you look at the top 10 killers in Ghana, out of everyone dying, 4 is related to non-communicable diseases, or 40% to non-communicable diseases. That is alarming. And from the public health point of view, what we always want to do is to make a healthy choice an easy choice for consumers. And all the talk we have been doing this morning is just focus on how can we make the environment, when you are going to buy food, it will help you to choose rightly, especially foods that will not be high in salt, sugar, and fat. There's one popular noodle here, because I will not mention the brand's name, but you know what I mean. Now, these days, children consume it a lot. Even in the night, people just have a tabletop and business is going on. It is booming.
We ain't joking.
Now, on that noodle, if you are not a nutritionist like me, that you know about what we call percentage daily value. Percentage daily value refers to the amount of nutrient that will keep you healthy and active. So every nutrient, there is what we call the RDA, recommended daily allowance. Now, when you look at the back of that, that is back of pack, the nutrition label, which the VC says she can't understand, and many of you can't understand. That's why we are bringing the front of pack food labeling. It says 72%, I think. That means when you eat just a pack, you have met 72% of sodium. You've met 72% of your sodium intake for that day. But some don't eat that small pack. They eat 2.
Double. 2
Now, so you have consumed the salt intake or sodium intake you need for the day. One of the ingredients in that noodle is also what we call monosodium glutamate. And it's also linked to hypersensitivity in children. So, and it also makes it addictive, delicious. So you go for it all the time. How can we solve that? One of those things is to create a healthy environment. And one way is to provide information for consumers to understand it easily. Not only that they will understand, it should capture their attention and say, hey, this is not good. Thank you.
Thank you very much, Prof. I want to take some questions from the audience. I have a question for Sen Ghana. Maybe I will ask you whilst you think about it. I'll take this woman has been raising her. Guta has asked one question already. So I'm coming. Let me go and come. You go and give it to Dr. Nyasoji. I'll get to you. Sen Ghana be mumbling over this question. How can we all help in the advocacy? As students, as practitioners, and everybody, because I think that it should be all hands on deck thing. So please think about it. I'll give you the mic in due time. Dr. Nyasoji.
Okay, so thank you so much for the presentations. When Prof. Amuna was presenting, he asked that industry would be engaged later and not very early on during the formulation of the policy. So we know that we always have the notion that industry would always want to have their way and make profit. But also our policies would also mean that they would have to reformulate their products. So at what stage should we involve industry such that, we do not just have the notion that they would always want to make profit, but if we engage them early, maybe they would understand us and come on board, and it will make life easier for all of us. Thank you.
Okay. Thank you very much for that. I think you also heard it from you also heard it from Guy, the Global Health Advocacy Incubator, and you heard it from Prof. La as well. and then I think Laurencia. We will involve industry when the policy has been finalized. Industry should not be involved in the process of developing the policy because of potential conflict of interest. And also from what you heard earlier on, the types of manipulations and attempts that sometimes is made. And you know, maybe we think of industry in terms of the small scale, how do you call it, operators that we have here. But we are talking about big industry. And at a global level, the influences that they try to peddle is not small. But they will only be involved when we have formulated a policy and we are now consulting and having engagements, education, awareness, social marketing, because reformulation is going to be very, very important. And that is where we'll bring industry in, but not at the development stage. Thank you.
Thank you, Prof. But I'm sure industry will still have a bite somewhat at some point in time. Okay, can we have Mr. Dankwa? But you there, you can ask your question of
Thank you.
Okay. After that, I'll go to, yes, my fellow mate, my fellow Zanto mate.
So I keep hearing everybody say our health are at risk, and it's scary. And indeed, it is, because if you take any population, a higher number of us give these sugary drinks and sugar-sweetened beverages to our children to take to school. Even in our hospitals, sometimes at the OPD, these SSBs are being sold at the OPD to the same patients we have been advising to stay away from these things that are at a high risk to their health. And these are serious issues we really need to take seriously. So my question come in two folds. Prof, please, what evidence supports the choice of the double duty front of package labeling approach? And how does it compare in effectiveness to a mandatory warning label system in addressing unhealthy food consumption to, you know, cleanse our food environment? And secondly, regarding the nutrition profiling models and mandatory positive labeling, does the FDA have the necessary capacity, including the logistics and technical resources, to effectively monitor and verify the health claims to ensure compliance so far as the regulation is concerned? Thank you.
Yeah, thank you very much. I agree with you that the food environment is toxic. In our hospitals, in our schools, on our campuses, everywhere. And that is because we haven't really promoted healthy options the way that we should. And that is something. In terms of the double duty approach, we have some good evidence. In South Africa, they've done a lot of work in this area. We have been learning a lot from the South Africans in terms of their approach and how they are going about things. We've also looked at particularly Latin America, and there is some good evidence that, you know, that's the way to go. FDA has insisted that whatever we do, it has to be a mandatory process. And they are the implementing agency for the government of Ghana. And so our job is to work with them to get a policy and then to get it through legislation. And then we can all then support the process of getting it implemented. At the end of the day, all we care about is that we are able to get industry to actually meet at least the minimum requirements for healthy diet out there, number one. And number two, that we are able to get the information and the knowledge to consumers. And three, that the consumers are able to make healthier choices. But number four, affordability, availability, access, these are going to be very critical. That is why the earlier points that were made, and I think, George, you made that point earlier, about the fact that you go to a place and you see more of the unhealthy options, and you are not seeing the healthy ones. And where the healthy ones are, they are still quite expensive. That is a challenge that we need to be thinking about. And I want us to all reflect on that. But I also want to make a wider point about our roles as practitioners, as academics, as researchers, that we need to take these policies when they come, and we need to embed them in the curricula as we're told, and we need to bring it to our students so that in the process, when they graduate and they are practicing, they can apply them. That way, we can be assured of sustainability. Otherwise, we'll just start, and as we're told, after some time, everybody goes home, and that's the end. I want to use my last statement to say that I hope that this symposium will come out with a communique which we will actually get out in the press so that at least it keeps the message going. Thank you.
Prof, rest assured that's going to happen. Danny, one word answer. Curriculum. Is it? Are we going to see something like that?
I mean, I've been thinking about that throughout.
One word. What can 3 sentences?
So yes.
Thank you very much. Please give it to the nutritionist. The hospital, where we are supposed to get this thing, the food environment. Mr. Nutritionist, what are you going to do about it? They say they are selling minerals for the diabetics, and I mean, it's amazing. Persons living with diabetes.
I think, as Prof said earlier,
yes,
there should be a policy guideline guiding us on the kind of food that should be made available at the various hospitals, so that anyone who is coming to sell something should think about the health implications of such product before sending them to the client. Because as my colleague have said, you go a diabetic client, they are giving them a malt.
Yes.
You can imagine the number, you can imagine the amount of sugar, tables of sugar that is in that malt. So we have to look at it, explain to the management and the vendors, so that if there could be any arrangement to make a special offer, so that those who will be hospitalized or those who come to the hospital will start getting healthy food from there.
But is there something you can do at your level to make sure that the food that comes around is...
That's what I'm saying. It will be a management level decision. Okay. That will be communicated to the vendors.
So you will speak to management?
Yes.
Okay. Prof.
Because they allow the people to bring such foods to the hospital.
But I'm sure if the nutritionist makes a big claim, something can happen to them.
And then moreover, the education is what is also very important. So if that's what maybe they can afford, and maybe they don't know the alternatives to that. So as I have a concern, we the nutrition officers and then the dietitians, we think that we need a special platform to educate people on healthy eating. So you see that a nutrition officer or a dietitian may be with their colleagues, they may be eating unhealthy food, not that they cannot afford a healthy one, but because they see it as normal, they don't try to educate or advise their colleagues on, you know the implications of what we are taking, because we all go and sit and drink. Yes, so we should make a conscious effort to be educating people around us on healthy choices and alternative
including
choices.
ourselves.
Including ourselves.
Okay, please give the mic to Prof. Amuma. Prof. Amuma, is it true that the legislation will include hospital and food environment? Or the policy? Can you speak to
the policy is for the nation.
General. Okay.
So its application is everywhere.
All right.
But there is no specific target in terms of restrictions at any particular facility.
Okay.
But as you're saying, we have something called local policies. And the hospital, for example, here, can have a local policy about what can be sold within its premises, for example. Okay. Those ones, you don't need government or a law for you to. Those are your own local policies.
Thank you.
And I think those are things that can be done.
Thank you very much.
And on our campuses, of course.
Okay, our campuses and in our diet therapy department. Professor Lo, I'll come to you. The questions now are becoming many. So I'll take like 4 questions. And then please, whoever it's addressed to, you note it. Then we'll address them in stream.
Okay, thank you very much. Nuno, Municipal Health Directorate. I think we are having this discussion because I feel there's one stakeholder we are not engaging. I don't know if they will be engaged along the line when we are developing the policy, and that is MOFA. Because we are having the discussion because of availability of some foods. And that's why most of the processed ones are coming up. Because if foods are available, like my brother said, now we go to the market, most of the products you see there are pre-packaged. It means already they are processed before even coming to the market. But if the fresh ones are available, what is available is what you can get. You can't go and buy more there. I think in line of the policy development, I think it will be prudent we actually also engage MOFA in making some food also available in line of our policy development. And then when I come to FDA, I think your submission is well noted, but I feel now the only time we hear your name is when a product is approved and they are doing adverts. I feel we should hear you more often and more louder. And I think some aspect of reprimanding some traders for selling some fake goods or something. Because now the only time we hear your name is that FDA has approved on telly. And most often than not is products that are not really healthy. But once we hear your name on telly and say approved by FDA, we are quick to go and purchase because it's approved by a government institution, which we feel is safe. And once you say it's safe, we feel it is safe for consumption. So I think it's a suggestion to FDA to also take.
Thank you. So we get a response on the MOFA bit and then approved or unapproved. This approved word is a very famous word in moderation or exams. What do you call that thing? Results declaration. Approved. Mr. Nurameya.
Okay. Mine is a suggestion. And the way things are going, looks like we are going to fight this for a long time. Because the things are coming down the market. I checked the literacy rate in Ghana and realized that we've moved from 61% in 2000 to around 80% currently. So it means that literacy rate. So it means that at least we have 80 out of 100 people in Ghana who can read short statements to guide their daily living. So it means these people can read what you want to implement. But the problem is that whilst we are increasing literacy rate, then a lot of people are also moved from being poor to middle income to high income. And such people, they like convenience. They think about time. A person who is in the middle class values time and doesn't want to waste a lot of time cooking and doing all those things. So convenience plays a significant role here. And one thing I've also realized is that this convenience also moves down to the nature of our markets. A middle class person or a higher class person, if you go to Medina when it rains, and I want to get Ademe to buy, or I want to get Prekese, I want to get Akokobesa, I want to get Dawa to season my meat, the process I'll go through to get the Dawa to buy, it will not be convenient. I'll go to Maggi because I want to season my meat. So I think that apart from doing all these things, whilst now the literacy rate is also moving up, it means we have to modernize our market environments so that the person who has parked his or her car will not be walking in the mud to go and get something that is traditional for the person to eat. Otherwise, they will not go there. Because if I go to Accra Mall, I will not get Dawadawa to buy. I have to go to Medina. So if that person, look at, you see, the way people behave is different. When they are getting money, it is different. And I saw this from the literacy rate. So whilst it is going up, we have to modernize our market environment. It will be convenient for the person to easily go to the market and get the simple things, the traditional things to buy, and we will not be struggling to deal with the influx of foreign materials that are damaging our lives. Thank you very much.
Thank you very much, Dr. Anu. We'll ruminate on it. Dr. Divine will ask his question.
Okay, thank you very much. I want to find out from the FDA whether you really, really sanction all the adverts that have those statements. Do you really sanction all of them? Because I'm really worried. This, you like no other story things that, do you really sanction all of them? Or people are just adding it? And I want to also find out what you can do. You mentioned some of the strategies people are using, like Tuesday double, and the fact that the numbers are increasing and the quantity is being consumed. Is there anything that the FDA can do about some of these things? And then to send, I don't know whether in your advocacy, you are bringing in the SHEP coordinators, the school health, the SHEP coordinators, the school health education programs. And then maybe this, whether you bring them in your advocacy. And this is just a suggestion. Is it possible that to FDA, instead of singing it out, saying it out, you just write it? Maybe even if it's vetted and approved, you write it than letting them say it out. You know, there's something that has to do with when I'm hearing it, vetted and approved by FDA. It gives me a certain confidence in it. So just let them write it, except if you still want to say it out, then you should also be able to say that this product has more sodium than the tolerable upper limit. And then add that vetted and approved. So that's just my suggestion for you to consider. Thank you.
FDA. Okay, you are the next person to talk. So let me take a few responses. Sen hasn't spoken today. I mean, don't do that to the lady. The only lady here, she must talk now. Please talk to us. Give us some soprano. The bass is too much.
Thank you very much. So, as part of our advocacy initiatives, the GAN part of the project is to analyze the school food environment. And in analyzing the school food environment, what they are going to do is to produce a report. And in that report, we are going to base on that report to do our advocacy. So whichever stakeholder is supposed to be involved will be involved. And should I answer the question you asked me? Yes. Okay. And as part of the advocacy too, we want all of you to be involved, and we want to take advantage of traditional and social media. Right now, everybody is on social media. Yeah, either on X, Instagram, WhatsApp. And we want you to start the conversation around the FOPL and asking people if they actually know what is in their food and what they are eating. When you start driving that conversation, it would make people talk about it. People will start asking questions. People can even draw petitions. People would even speak for us before we speak. So I think that it is very important that we take advantage of our traditional and social media. Thank you.
Thank you. So we'll take FDA. So when you are doing TikTok, it's not only your pictures. Facebook, write something. Today, post something on this. Anna, will you do it? Give me a wave if you will do it. God bless you for me. Please talk.
Okay.
FDA.
I think FDA is big.
It's big.
Yes,
you have a lot of issues.
Yeah. So,
Heat.
with the question about increasing our presence on social media and other media outlets, yes, we are working on that. I think currently all regions do have public relation officers. First, we didn't used to have it, but now regional offices also have public relation officers. And they are working on programs where our issues and some of the things we also worked on will come out more in the media. Then yes, the adverts that you hear, this advertisement is FDA approved or this advert is approved by FDA. Yes, they've been sanctioned. So I would want us to understand something here. We are approving the advert. So ideally, we don't want you to come out into the media and put out an advert that has claims about a product, in as much as you've even registered the product. So the first thing we do before we approve your advert is to register your product. So if your product is registered, and like I made mention, during registration, we work with limits. Ghana Standards Authority have standards for every food product that is in the country. For products that they don't have standards for, we move to Codex to be able to get the acceptable upper and lower limit. And before you bring a product, there are parameters that you would have to test. So let's say for drinking water, there is WHO standards for the parameters that you need to be tested, where you have upper and lower limits for both the microbiological and the physicochemical aspects. So if your product falls within the acceptable parameters, which we FDA have not set, these parameters have been set by the Ghana Standards and Codex. I want to make it very clear that we use the Codex and the standards to work. So if your product falls within those parameters, both the upper and the lower limits, we approve the product based on what standard that we've been getting. I hope I'm clear.
Yes.
So if we've registered your product, that means that the product has fallen within those acceptable limits. Then you come to the advert. We want you to make claims about the product that fall in line with our advertisement guidelines. So if you have a medication, I'm just moving to, let's say, a part of a medication. Then we have something we call Shadow 5 diseases. Diseases that you can't cure, you can only manage. Then you make claims that, oh, okay, maybe this medicine or this food product is going to cure that disease. No, we won't allow you to air that advert. We will take that aspect of your advert out. We will tell you, no, this is not a good claim to make. This is not a right claim to make. So I want to be clear that the advertisement is just to make sure that what you are bringing to the media space is seen. There is sanity in the media space about that product. So yes, there could be unacceptable levels of sodium in that product. But if Ghana standard says that the sodium should be maybe 2 grams and it's within that same 2 grams, we will register your product.
Thank you very much. So, the approve no. the statement or the writing, I want to, what do you say?
The statement has been modified over the lifespan of the, we started with this advertisement is vetted and approved by the FDA, then we shortened it. The production space is difficult. Those who come for these adverts, some of them don't even, if you listen to some of the adverts, they quickly speed up that aspect of the, yes, just for the space. But we are trying to also put out a tag so that at least you, the consumer of that advert, you know that, okay, this advert has been approved by the FDA, so there's a likelihood that their product has also been registered. If we take that aspect out, yes, someone is listening to radio, you play the advert and you don't play the tag at the end, how does the person hear it, that this advert is approved? Someone is watching TV, but the person's attention is just drawn off the TV for a while, but he knows that this is the advert they are making about the product, but my attention is off. If I don't hear the tagline at the end of the video, how am I able to know that, okay, this advert or this product has been registered by the authority? So yes, it may come off a bit ringing in the ear, but you need to bear with us that yes. But we would have a look at it if that is the general concern from the populace. Right. Then we'll send it up to management.
You want to make a statement because the Guta woman is itching to talk. 30 seconds or so.
30 seconds. So just want to say that. So if FDA approves a product, like we're using the noodles as an example, one pack gives 70% of your sodium intake. Then actually, now responsibility, the higher responsibility is on you, the consumer, knowing that you've taken 70% of your sodium intake from that one pack. But you are here to take breakfast, you are here to take probably supper, and you by all means will exceed that. Yeah. And that is where we as a professionals come in, and that is why we are happy, knowing that it takes just 10 seconds for a customer, a consumer to look on the food pack. Yeah. And hence the approach with the front on pack, whether it's the traffic light or something, force within that 10 seconds to give you the necessary information you need to make informed health choices.
Thank you very much. So this is coming to augment the work that FDA is doing to give further. Let us salute talk. Osofo, today you become Osofo for 1 minute.
Well, I just want to say something about healthy and safe food. When we say a safe food can be unhealthy, and most times FDA's rules is to ensure that what comes onto our shelves is safe. But what we have been talking about here has been also looking at unhealthy food as a food that is linked to obesity or weight gain, and that is also associated with the NCDs, that's the non-communicable diseases. So let's not confuse safe food and healthy foods in that context. So, for example, naturally, there are some foods that we call them core foods and non-core foods. There are some food, because of their processing, they add more sugar, they add more salt, they add more fat, and that is normal for those foods. But what we as in the public health space are interested in is how can the consumer know that, look, this is a healthy option for me? And we are saying that the front of pack food labeling will be a quick way for that assessment. It just helps the consumer to just make that quick decision. And that is what we are talking about. And let's also re-emphasize that we are not saying front of pack is the only policy tool. It's a whole package. Already in Ghana, we have the sugar sweetened beverage tax that was talked about in the presentations. They are also working on how to restrict advertisement targeting children. And one of those things that has worked for transnational companies, including tobacco and food, over the years is that when they target children, it means that these people are hooked up to this and they grow with it. Because habits don't die quickly, you know.
Thank you.
So that has been their strategy. So our policy is also, and for example, a clear example was the Chile example, where they introduced the front of pack warning label. In Chile, at a point, they had almost 70% of their population obese, and 50% of their children also obese. And that was so alarming. So they brought this front of pack as a policy package. So they had restrictions, advertisements, targeting children, and also the front of pack food labels. So we are also in Ghana, already we have had the sugar sweetened beverage tax. And we are saying that this also should be part of it. And in doing that, we are ensuring that the food environment is healthy.
Thank you very much. So I'll come back to Prof. Amuna.
Yeah, I just wanted to make some very quick comments.
The MOFA.
Two comments. Yeah, the MOFA. Just to assure you that the Ministry of Food and Agriculture has been part of the policy making process. So their inputs are part of it. The other point is about the literacy rates. Now, if we have 80% literacy rates, what we need to do is to translate that into health literacy and nutrition literacy rates, which we don't have. That is part of the problem. As you said, people move upwardly in terms of education and knowledge and so on, and then purchasing power. But they don't necessarily go for the healthier choices, because being literate doesn't necessarily mean that in terms of health and nutrition, the person is knowledgeable. Elsewhere, you are right. In the markets, you can enter a supermarket and go to a section where you can pick fast foods or ready-made foods that are healthy, because they have translated this into how they produce or they package the foods for consumers. And they are labeled as well.
Okay.
Thank you.
Thank you very much, Prof. We are far behind time. Our time is almost up, but I'll crave your indulgence to give me 15 more minutes. We're billed to close at 2:45, but I'm begging that we move it to 3 p.m. If it's okay with you, say yeah. Oh, Charlie. The eyes have it. So we'll do 15 minutes more. With your indulgence, then we'll close. All right? So I'll take 3 more questions, after which we are bringing this thing to a good. Right now, I have the power to decide who to call. So Guta will have 1. A student will have 1. And then another person will have 1.
All right, please. My question is to Food and Drugs Board. Please, is it possible we get products into the market with fake labeling? And should that happen, what severe sanctions are made to deter people from this act? And my second question is to Gan. Please, about the school feeding. I think if you want the effectiveness of it, if you want healthy food to be provided to the school pupils, they need to do consultation with the stakeholders. Because as it stands today, school feeding per child is 1 cedi, 50 pesos. With that, no healthy food can be provided. Thank you.
All right. Any other? You're a student. Oh, public health, you must get some. And now, Dr. Faith, public health. If you like, take all the 2 questions.
Okay, thank you very much. My name is Nana Kwame Bequin. I'm a representative of Africa Catalyzing Action for Nutrition and a student with the Fred Newton Binka School of Public Health. My question is, with regards to labeling, is there any procedure or any specific thing that is done to address local food vendors? Because students or middle income people do not have the time, or some people do not get time to actually go to the market, buy the stuff and come. But they would rather go to local food vendors and other food vendors. Say the KFCs and the chicken mans. I personally have not bought maybe a chicken man, food from chicken man with labeling or any form of packaging on it. So if you do, or if we go through all these processes to put labelings on all these things, but then they get to the local vendors and they do not also put their labels on it for us to see this is the amount of sodium, this is the amount of this in this food, or the amount of fat in this food. It would also make a lot of people some people who are buying the food to prepare would get that, and then others who just go here do not get that information. Thank you.
So when you go and buy your rice and stew, and they put a label on the rubber for you. Powerful. Last one. Who do I give it to? You are from which department? Ghana Health Service. Oh, okay. The student has asked a question, so Ghana Health Service will ask the final question. I'm so sorry.
My name is Godwin Tewia Jasa. Mine is just simple. My earlier worry was nutritional facts that are in percentages which cannot be read by people, but it was allayed during the presentation. That it will be made simple in red, gold, green colors. I want to find out whether this red, gold, green will be put on the nutritional component, each nutritional component in the food that we'll be buying. Thank you.
Okay, so please, I'm biased. My student wants to ask a question. So, last one to my dear student.
Thank you very much. Please, I wanted to ask the FDA, since the people know that you'll be analyzing their product, they can definitely produce a product that will meet your requirements. But after such product has been brought to the market, do you reanalyze those products before those products are re-registered after a year? Thank you.
Okay, so please, can I take a few responses from that? Target, Asalu, please wait for me.
Okay, so let me just address your students.
Quick to the point.
So we do something we call post-market analysis or product quality monitoring. It's done yearly, so we target a particular cadre of products. So if maybe we are doing sugar sweetened beverages, we would pick samples from the market. So the samples are obtained from the market, not the producer. So we'll compare those samples, the analysis, to whatever you presented during registration. And if we find variances, there would be sanctions. Okay. So we can go to your production. Maybe sometimes the production facility, they have flaws. Maybe we are humans. We are prone to error. So there's a likelihood there's an error. We do something we call industrial support. We go to the industry, we see if there's an issue, we resolve it. If it's something that we find out that is intentional, then there will be sanctions that apply to us. So yes, we test products after we've issued market authorization to products.
I have 2 more minutes.
Then the second question about the fake labels. I don't believe there's a perfect system. Maybe heaven. Yes, we have issues with counterfeit products coming into the system. With even the regional office, we have border posts. Shianyive, Aflau, Boglu. Even Aflau alone, they have over 15 bits and pillars. And there are so many illegal routes that people pass to get products into the country. Some of these places is very difficult to man. They are just very narrow paths. And it would sometimes they even come in the night. It will be very difficult to get access to some of them. So yes, there is an influx of fake products. It will come. Products that are produced in other countries that bear logos of even original products. They will come into the country. But what we are also doing to try and alleviate such a situation is the post-market surveillance. We go into the market. When we identify some of these products, we come do the test, some of the tests in the mini lab we have in the regional offices. And if they don't match, we move and pick those products from the market. Sometimes we do surveillance. We trace to see where they are coming from. We plant informants around, we get information, then we will follow to where they are doing it. With the issue of the adulteration of palm oil with Sudan dye, we trace to be able to go to Togo to see where some of these people are even putting the Sudan dye into our products and how they are coming into the country. Then we cut that part of the chain so that if the chain is broken, some of the products don't get into the country. Thank you.
Gand. Okay, Asalu. 1 minute.
So I want to just clarify something. One, label is mandatory for pre-packaged foods. In some countries, there is also what we call menu labeling. When you are buying food from your restaurant, you see the calorie and other things in the food. But in Ghana, we as coders have said is every food that is pre-packaged. But you know that a lot of granola you buy is pre-packaged. It doesn't have label, is that not it?
Yes.
So there's more effort to that. But another thing that the FDA man should also clarify to you, and I will say it, is that nutrition labeling in Ghana is not mandatory yet. And over the years, they've complained about capacity. But they are promising us that very soon, nutrition labeling for every food will be mandatory. For countries in the West, if you prepackage Kenke and all that to any supermarket, you see a nutrition label on it. That is the back of pack nutrition labeling we are saying. But in Ghana, the nutrition labeling is not mandatory yet. And let me also say that front of pack, usually any product that will have any kind of front of pack will also have the back of pack, which is what we call the nutrition fat table. So the nutrition fat table is always it's mandatory in countries that have the front of pack labeling. So that's the clarity I want to bring for the audience.
Thank you very much. Also for Danny, you have the last word.
So we at GAND, what we are doing in partnering with this project is just to be prepared to stand in the path of the floodgates to minimize and reduce the prevalence of non-communicable disease that is expecting. And we are grateful that all partners, all hands are on board to help us achieve this. Thank you.
Thank you very much. Ladies and gentlemen, a loud round of applause for our panelists. Oh, do a resounding. If you don't clap, you're a suspect. Thank you very much. We are very grateful for your time. Mr. Bryce from FDA, Baba from Send, Dani, Prof. Amuna, I see young Amuna over there, and Asalu, and our nutritionist. Thank you very much. Baba is our student. Are you still in school? You finished? Thank you so much. Thank you so much. ID units will take over and take us away with the final bit. I'm sure the lunch, you are waiting for the lunch, right? Okay, you go for
Thank you very much. I'm sure you all bear with me. It has been very, very, very an interesting day. It has been an interesting day. And all too soon, we have come to the end of the program or the symposium. Today, we have explored science, policies, and pathways for front of package labeling in Ghana. The discussions have been insightful, and the impact of this is very clear. Accurate, transparent food labels can save lives. At this point, I would want to welcome my head of department. Okay, yes. So he's the head of the local planning committee. And
please, a louder round of applause. Head of local planning. He's had sleepless nights over 2 days. Oh, a louder one, please. All the dietetic students should stand on their feet and clap for their HOD. Aha, very well. Your mama man the fans.
Okay, thanks for the opportunity. Because time had far been spent, I will just be very brief with some few take-home messages for us. I think the first is what this symposium has practically illustrated in terms of healthy foods. We've offered you healthy snacks. We've offered you healthy water. We will offer you a lunch. And I'm hopeful you would all be appreciative of that. The first point is that you should know what you eat. It has been very emphasized that we should understand what is entering our system. At the cases, increasing cases in diabetes, obesity, overweight cases, what we've also realized that it is very critical that we include nutrition education, especially in our schools. We've agreed that food of pack label should be large visible and also be reader friendly, and also we should consider the visually in the design of. To our politicians and those from industry, we should also understand that a very good food and would also endanger or be beneficial for all of us, so that we can have a food ecosystem. So finally, to just borrow from Prof's last conclusions, that the fight of public health for healthy foods should continue. We should not give up, and we all have a role to play. Thank you very much, and have a good afternoon.
Thank you very much, Odi. As you well noticed, it's a gentle giant. Okay. So at this point, we have the post-test available. We hope you have learned. If you have, prove it. Take the survey and let us know what you have learned from this. As you are doing this, we have a very honorable lady who has something to tell us. We have partners, stakeholders here, and she has a word for you. Dr. Nyasoji.
So good afternoon to us all. I hope it's very insightful and then a learning curve for all of us. So I would want to just briefly take the opportunity to say we are very, very grateful to the sponsors, especially Leicester. If they had not sponsored, we would be here. So I want to thank Ghana especially, and then we also thank Ghana for sponsoring our gathering this afternoon. We're also excited about our very renowned speakers who took time off their busy schedules to impart some knowledge to us. So Prof. We are thankful to you and all the other speakers. So there are various representatives. So FDA, though you had a lot of bashing, we thank you so much. And then a rep from the Ghana Health, we thank you. A rep from Good, we thank you. And then very renowned, hey, before I forget, our VC, before she's not here, I forgot. But we thank her so much because she had busy schedules, but she also had time to be with us. And then the registrar as well. Our dean, the host of our school, we are so grateful to all of you. So the advocacy, our students, so we want to take it. The hashtag is that there should be in front of the platform. All of you who came, Faith and her team, we are grateful. And then our very own Odi and his team who organized everything, the various committees that work tirelessly, we are thankful to all of you. So we pray for a safe journey to all. We are at front of back labeling will be successful. Thank you very much for coming, and God bless you all.
Thank you very much, H.O. Please, my co-MC, come and join me. What do you think about my co-MC? Par excellence, the founding HOD of the department, founding HOD. Don't joke with her. Very, very powerful woman. Mrs. Bekona, the doctor. Thank you so much. We want to say that you have to take the test. I'm giving you 1 minute. We are within the so I'm giving you 1 minute to get up from your seat and go and do the QR code if you have not done it. If you have done it, you can feel it right now. I'm giving you 1 minute to feel it right now. We close.
Soji, post test, is it available? Okay, so we have them on the walls. We have them through our WhatsApp platform as well. We hear from you, so please do this survey.
Please do well to do the survey. We need it for research purposes. And to us, the school office, the big men, Bismarck, and the rest. Thank you for your help. I butchered registrar's name, and I want to come again. She is Madam Ya Amankwa. To help and tell her I redeemed myself. Fortunately, she wasn't here to take it. On this note, I don't know if there are any comments.
Not really.
Okay.
Just to say, hashtag FOPL. Let's make this happen.
Is hashtag what?
FOPL.
There's a W.
Should we still add a W or we should go this way?
They're saying the W is important. Okay.
FOPL.
So hashtag what?
FOPL.
Okay, so we'll all do the hashtag and we leave. So lunch, how are we getting the lunch? We'll sit. Come Ghana, we like this one, there will not be any queue. You sit where you are whilst you are feeling it. So on behalf of my dear co-MC, Madam Mrs. Eunice Bekonate, RD, PhD, and on my own behalf, Nana Kofi, you can call me Dietitian 1. If you see me, I'll respond. And on behalf of all the collaborators, sponsors, and on behalf of our school and department, we want to thank you for making. You've been a wonderful audience. Clap for yourself, please.